Good morning, everyone. I'd like to call to order this meeting of the Texas State Board of Examiners of Professional Counselors. Today is May 6th, 2022 at 9:09 a.m. We are meeting today over Zoom. Let's go ahead and do our roll call. I'm Stephen Hallbauer, public member. Dr. Taylor.
Dr. Christopher Taylor, Vice Chair, present.
Dr. Bradley.
You're muted, Dr. Bradley.
Dr. Loretta Bradley, professional member.
Janie Stubblefield.
Janie Stubblefield, licensed professional counselor, professional member.
Brenda.
Good morning, LPCS professional member.
Dr. Amuna.
Dr. Leah Amuna, professional member.
Vanessa.
Good morning, Vanessa Hall, public member.
And Pastor Roy.
Good morning, y'all. This is Pastor Roy, public member.
Garrett is sick today. I've made it a note that this will be an excused absence for him. Christina, please introduce staff.
Good morning. My name is Christina DeLuna. I'm the board administrator for the LPC board. We also have Brenda Skiff, who is the BHEC executive director, executive assistant. We have Victoria Benitez, who is the board attorney. Kenneth Long, who is not here today, but he is a new assigned board attorney for the LPC board. We also have John Bridges, who has been assisting with the LPC program, who is an attorney. Patrick Hyde is our general counsel. Timothy Spear is the operations manager, and we have Daryl Spinks, who is the BHEC executive director.
Thank you. In your materials for today, you've had a copy of the February 11th board minutes. If you will, please pull those minutes up, and it'll take a few minutes for you to look them over. And once we've all had a chance to review them, I will entertain a motion to approve those minutes.
Daryl, when are we moving over to the video minutes?
We should be there today.
They have to, BHEC has to adopt the repeal of that.
Oh, is it? Oh, is it okay?
Later this month, so.
Yeah, on the 18th, I believe, is when the BHEC meeting is. We're almost there.
If the minutes look good, I need a motion to approve.
And make that motion to approve the minutes.
I'll
Second.
second.
Dr. Bradley made the motion, and I have Janie with the second. All in favor of approving the February 11th meetings, please raise your hand and say aye.
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 Thank you. Okay, moving forward to agenda item number 4, discussion and possible action regarding Rule 681.2 and 681.83 related to the definition of counseling degrees, counseling related degrees, and the academic course content required for such degrees. We have received a petition on this from Texas Tech University Health Sciences Center. They do have a representative who has requested to speak today. They indicated that it would take no more than 10 minutes for them to present the reasoning behind the request. The board has accepted that 10 minutes, and their representative is here today. Christine will let you in as a speaker.
Do you have the name of the person?
Do
I thought I had it, but I don't.
It's
believe it's,
Christina, it's Renee with her hand up.
Oh,
the
there it is.
provost, I believe.
Okay, thank you.
Okay, can the board hear us?
Yes.
Okay, thank you. Thank you very much for allowing us to speak to the board today. I'm Darren D'Agostino, the Provost and Chief Academic Officer for the Texas Tech University Health Sciences Center. I'm joined by Evan Spears, who is our chair of our counseling department. Again, I wanted to thank you for this opportunity to talk with the board. Just briefly, the Texas Tech University Health Sciences Center has been providing graduates in the health professions fields to the state of Texas since the 1970s. We've actually graduated more than 30,000 people, and we represent about 25% of the healthcare workforce in the state of Texas. Our School of Health Professions, where our counseling degrees are administered, contribute greatly to this significant number of graduates, and in our most needed fields, in particular, the mental health services. Since that time, we've graduated since 2017, and up until 2021, we've graduated 89 addiction and rehab counseling professionals. And it's actually these individuals prior to 2021 that we are here talking about today. Our reason for this petition is going to be discussed in future points. The main issue here and our goal is to ensure that our graduates of the addiction counseling and clinical rehab counseling programs are afforded the same licensing opportunities as our graduates who have completed the identical curriculum, which the board has previously determined meets the standards for counseling field. So between 2017 and 2021, TTU-HSC's curriculum that was taught in addiction counseling and rehabilitation counseling programs has actually remained the same. No issues during that time frame in these graduates was ever received, no concerns and no challenges for them achieving their LPC. Students were receiving licenses based on Rule 681.83 subsection A, which held graduate degrees in counseling from an accredited school. In fall of 2021, the curriculum was determined to be counseling related by this board for the first time. Students are now being told their curriculum is deficient and does not meet the counseling related requirements, and their degrees should still have been accepted under 681.83 subsections A. The curriculum covered all topics required and but integrated these topics into other courses. And because those courses used different names, it was difficult to identify that curriculum. After presentation to the board through a petition from students seeking licensure, it was determined that these curricular elements were indeed present. It's important to note that all curriculum is developed using nationally accepted standards by the accrediting body of which we are accredited, KCREP. It is delivered using learning sciences and it's validated through evaluation and assessment, which is also accepted nationally through our licensing board exams, the NCE. Our students are expected to pass the NCE and the jurisprudence exams, pass classes required to graduate based on KCREP accreditation standards, and also, since our university is SACS accredited, we are following those standards, and it is mandatory that we do. Our students complete internships in their fields, but with these changes and the interpretation of the rules in 2021, we've had students that have been challenged in receiving a license and indeed have had to petition this board for licensure. One student was told to actually shred his license. One student had a job offer and is potentially at risk of losing that job. We have other students right now that are attempting to get a license and will likely be petitioning this board as well. Back in February, 2 of our students, one in addiction counseling and the other in rehabilitation counseling, presented to this board, and the board agreed that they did meet the standards. Our programs meet KCREP standards. KCREP continually researches and revises its requirements to ensure learning outcomes are met. We know that 27 states cite KCREP in their rules regarding meeting educational requirements for licensure. Of the remaining 23 states, 15 of those use KCREP core areas. So topics that I'm sure this board is well aware of. KCREP is recognized as the accrediting body for counseling programs by the American Counseling Association. The Texas counseling license recognizes individuals as licensed professional counselors. It's not limited to mental health counseling. Counseling is an umbrella profession, should not be defined by a single specialty within it. Mental health counseling is not the only specialty area, and there are 7 other specialty areas that KCREP identifies. In the United States, there are only 10 states that have mental health counseling as a specific license. Those 10 states have carved out mental health as a separate license. And if indeed that is a quest of this board, that is something that we would highly recommend get done at the board level, and not to try to impact the other counseling professions that the LPC license allows to practice in the state of Texas. An LPC is a license for mental health counseling, addiction counseling, clinical rehabilitation counseling, and every other specialty in the counseling profession. So in essence, counseling is an umbrella profession and should not be defined by a single specialty within. The council's 2021-2025 strategic plan actually provides and references under the heading titled Licensed Professional Counselors, the council group addiction counseling and mental health counseling together. So even the BHEC's definition and strategic plan identifies this. We're actually interested in some rule amendments. We're proposing that 681.2, adding counseling to the definition under these rules. It will fill a gap that that exists currently in the rules for the board. Counseling related is defined, but counseling is not. We're also recommending that the definition of counseling, which is clearly described in the Texas Occupations Code 503.003, be inserted in 681.2. The BHEC is charged with administration and enforcement of Texas occupation codes 501, 502, 503, 505, and 507. And because of that, it is suggested that the actual definition for the actions of a counselor be included, and that would be under 503.003. These areas represent foundational knowledge expected in the industry to adequately perform and ensure public safety. Public safety is primary charge of a licensing body, and it is one that has been recognized by Governor Abbott in 2019 when he was establishing the separate board. We're also recommending in our petition, which I know you have read, that added language be added to 681.2, which helps define the specific roles of the different counseling specialties. 681.83 subsection A further clarifies how an applicant's degree meets these requirements. And just like an accredited school, an accredited counseling program equally provides the educational content required for an LPC. I am actually trained as a physician, and my license in almost every state says that I can practice medicine and surgery. My specialty is not surgery, and it would never occur to me to perform surgery outside of that license. There are subspecialties, and everybody's license does allow for that, for the practice of what they are trained in. I don't see, and we as a group at the university do not believe that this is any different than another licensing exam that has subspecialties, a licensing body that has subspecialties in different areas to be practiced. So in conclusion, Governor Abbott's 2019 letter to the state agency heads, which states that that he does not want to discourage or hinder individuals from pursuing professions that require licensing. Additionally, the executive branch agencies should reduce fees and burdensome educational requirements, including obstruction through interpretation of rules that may prevent individuals who are trained from an accredited program through an accrediting body that's nationally recognized. And so no excessive burden should be placed on these individuals when attempting to get a license. In essence, Governor Abbott is looking to ease licensing regulations. He wants to stay true to the Texas Constitution to protect economic liberties, as well as protect the safety of the individuals seeking licensure. As a provost of a major university in the state of Texas, I can tell you that the interpretation of the licensing rules is changing the ability of us to educate our students by adding burden to those students in order to complete their requirements. However, we are willing to work with this board to identify an easier path for those students. And in fact, we have worked on our curriculum and the delivery of our curricular model to meet those standards should an interpretation of counseling be made by this board. Moving forward, we don't anticipate there would be an issue, but we do have a concern about 89 individuals who in the past have been granted licenses in their respective states, including the state of Texas, based on the rules and regulations that have been set forth by this body. We're asking that that be continued for anybody who has graduated prior to 2022, be accepted as licensure, and that these individuals not have to jump through the hoops of presenting to be approved, just like the two individuals who petitioned this body in February. I'll stop there and thank you very much for allowing us to present this petition.
Thank you, Provost Agostino. If you would, please go ahead and remain here on the Zoom. Board members, before we begin our discussion, does anyone have specific questions for either Provost D'Agostino or for Chair Spears? Okay, hearing none. This petition was analyzed and discussed by the Rules Committee last week. We spent a good amount of time on it, a good, healthy discussion. At this point, I will hand it to Dr. Taylor, who's going to summarize what the Rules Committee discussed, aspects to this that we considered, and ultimately the position that came out of that committee meeting and why we feel about that position the way we do. So, Dr. Taylor.
Thank you, Mr. Chair. Provost, your last name D'Agostino, is that right? Am I saying that right?
D'Agostino, yes, thank you.
D'Agostino, thank you very much for your petition and your delivery just now. I greatly appreciate a lot of what you said and agree with a lot of it. In our Rules Committee meeting, in the review of the petition, we felt that a lot of it was unnecessary in review of 681.83A, which just simply states an applicant who holds a graduate degree in counseling from an accredited school is presumed to have satisfied the academic course content required described in this section. And so looking at this, it seems, it was our opinion at the committee level that this degree should have just been viewed as an accredited degree in counseling and that it should not have gone to review, as KCREP accredited it in counseling. And so that's kind of where we should have stopped. I think the confusion occurs as universities continue to change the names of the degrees, and it's not something we can keep up with because, you know, tomorrow a university next fall is going to come out with a new creative name for something, and staff has a very hard time keeping up with that and knowing if this is counseling or counseling related. And 681.83A is just very clear that if it's accredited in counseling, which KPREP accredits counseling degrees and only counseling degrees, that would make sense and that rule should apply. And if SACS-COC has it accredited in a counseling degree, then again, that rule should apply regardless of what the name or title of the degree is, because that doesn't really tell us the whole story. And so that was our view at our committee meeting last week, Mr. Chair.
Thank you, Dr. Taylor. Janie or Brenda, anything to add on that from Rules Committee from your point of view?
I have nothing to add. I think we decided in the Rules Committee that Dr. Taylor was going to speak for the committee.
Okay. Thank y'all. So that was the gist of the Rules Committee. If a degree has a KPREP accreditation, then we view it under A, that it is a counseling degree, and that no further review of the coursework is required. That is a change from the way that that the staff has been evaluating this, and they've been evaluating it based on just somewhere back. They received a direction from the board that they didn't like that. But what the Rules Committee has proposed is that we put that back on track, that we follow the plain language of the rule. And it is accredited, the degree is accredited under the KPREP, that it is a true counseling degree, and that that degree is evaluated under the standards set forth in A, and no further review is required. We accept it as a counseling degree.
And Mr. Chair, to clarify, it's not just KPREP, it would be any accreditation in counseling. I think KPREP is easy because my understanding is that's all that they accredit. But any other accrediting body that has also accredited this as a degree in counseling, 681.83 would direct staff to accept it, regardless of the title of the degree. If it is in fact accredited, then it should be good.
Okay. Okay, we're gonna have a board discussion on this. Dr. Bradley, you raised your hand. Go ahead.
I know that KCREP accredits 7 areas at the master's, or they call it the entry level. That's addictions counseling, career counseling, clinical mental health counseling, rehabilitation counseling, college counseling and student affairs, marriage, couple and family counseling, and school counseling. Those are the 7. So does that mean a degree in college counseling and student affairs? Or does that mean a degree in marriage, couple and family counseling? Regardless of the courses that they've had within that we would just automatically say, okay, 681.83 item A applies.
Dr. Bradley, that would probably require staff to review the accreditation to ensure that it is accredited in counseling. And if that is an accreditation in counseling, then yes, I think it would apply. We would just have to see if that's accredited in counseling.
Because I was specifically naming the 7 areas that KCREP accredits.
Mm-hmm.
And of course, in those 7 areas, if you look at the KCREP requirements, they vary. And the reason they vary is KCREP knows that each of these areas have a different focus.
Yeah, I would like to, steer the conversation away from just KCREP and discuss it more broadly as far as just accreditation in general. Because I don't think our rules are focused towards, nor is it our position to focus towards the KCREP standards. I think it's more of our position to focus on counseling standards. And there are many accrediting bodies beyond KCREP. So I don't want to play favorites by saying, well, this is what KCREP says, so this is how we'll do it. In our review of 681.83A, we just said if it's any accrediting body has accredited it in counseling, then we're good to go. And that should be easy for staff to determine by looking at the accrediting body, looking at the description of the accreditation, and should be able to move forward from there.
Dr. Amuna, go ahead.
I'll piggyback on Dr. Bradley without mentioning KCREP and just say that my concern would be that if anybody, any like big body be accredited for counseling as it relates to career counseling, that curriculum, that transcript might look a little bit different from someone who's doing, say, addictions counseling. And to have both of those individuals get the exact same licensure for career counseling because they're accredited by someone, and addictions counseling because they're accredited by someone, coming into the practical application of the work, just as a hiring body, that there's an expectation that I would have of training and experience and clinical ability that I might not get from that person who has career counseling versus someone who has addictions counseling. And then it would be me as an employer to tee out what their actual ability is, because now I can't rely on the license to just tell me what their ability is.
Yeah, I appreciate that view, Dr. Amuna, but they still have to pass the NCE. They still have to go through a 3,000-hour associateship, and they still have to be able to go find an employer, which today is extremely easy because we don't have enough therapists to keep up with demand. We introduced 681.83A to solve this problem specifically because we had associates, we had pre-licensed associates, we had graduates that were waiting. And I am not exaggerating when I say 18 months to get licensed. Now, you tell somebody who just graduated from a school like Texas Tech, who has probably 30 to 60 to, I don't know, like me, $150,000 in student loans, and I got to wait a year because somebody reviewed my transcript and found that I missed a class. That wasn't even really yes, it's my responsibility, but the school should be helping me here, walking me through it. Things change, things get missed. So we had a massive backlog for this, for something that I think our provost here is accurate, that the governor is telling us to fix and Sunset told us to resolve. And so that's why we introduced 681.83A, saying that if they're accredited in counseling, then we don't need to go into the weeds on it. If it's counseling related, meaning that they're coming from outside of the counseling world and trying to become a therapist, then we want to go into it a little bit more just to make sure. But to trust the accrediting bodies who do this for a living, this is what their job is to ensure that these programs are up to the right standards, that they are educating the students appropriately. If we want to have a discussion about whether or not we should get rid of 681.83A, I'm open to that, but that is a different conversation. And I think right now the conversation is, does 681.83A apply here? And I think that it does.
Go ahead, Dr. Bradley.
Dr. Taylor, you mentioned other accrediting bodies. Give me some examples that your committee might have considered in addition to KCREP.
I would be happy to find that for you, Dr. Bradley. That would be the Department of Education. Leave a list of 14 accrediting bodies that we reviewed when passing 681.83A, I think, Christina, 4 years ago, 5 years ago? So it would be any accrediting body that issues that's recognized by our government. Let's see. I think the most common for us is SAC COC, but they're regional, so it would be any of them, I think. Contents.
You talking about the chia bodies, Dr. Taylor?
Yes.
Yeah.
So I don't know if somebody has that list, so we can pull that up, but that's what we pulled when we had the discussion originally, I want to say 4 years ago or so.
I do not have a list.
Okay, we don't need to belabor time, I know. May I ask another question? Oh, okay.
Thank you.
Yeah. Yeah, so it was definitely these programs. It was also KCREP was also considered in that as well, and any other recognized body that issued accreditation for counseling is what we view inside the U.S. jurisdiction, obviously.
U.S. Department of Education would probably fall in there as well.
Yes.
Go ahead, Dr. Bradley.
Mr. Spinks, help me understand. I know you've been involved with the psychology board. You have clinical psychology, you have counseling psychology, you have experimental. How does the psychology board do this, if I may ask?
Glad you asked. I was going to let y'all finish a little bit and then talk to you about that. The psych board has what we call a generic license, just like y'all do. And that's not a negative connotation. That's more of a legal context to how we view y'all's license. You have one license that allows you to practice the full spectrum of counseling services. But within that spectrum, in psychology, they have the same thing. A psychologist is a psychologist. They can practice the full spectrum. But we have rules that limit the areas. They are confined to those lanes which they are competent to practice in. So we define that by rule. We don't say access to the profession is contingent upon you meeting this specific list of coursework that then trains you to practice in all areas. We say, if you've been trained in counseling psychology, come on in. Just recognize you got to stay within that lane unless you get training and expertise that allows you to move into a different lane. But we don't police that on the front end. We police that on the back end. We use our competency rule to make sure that doesn't, that they do their homework before changing lanes. And really kind of what the rules committee is proposing here is that type of a methodology. It's, hey, we recognize this is a generic license. It lets us practice the full range. But when we come in, if we come in as an addictions counselor, you got to stay in that lane unless you get the training and the experience needed to change lanes. So that's kind of how I'm viewing this issue.
Go ahead, Dr. Bradley, if you have a follow-up question.
I just want to be sure, Daryl, that I'm interpreting this correctly. If I come in as a college counselor, I'm licensed as an LPC. Does that mean that the work that I do stays within that lane? And in this case, it would be college counseling?
I think you would have to, because you're not competent to practice clinical work. You're not going to have the expertise and training to practice clinical or forensic. You're going to have to stay within that college counseling degree. Otherwise, you're not going to know what you're doing. Now, your license will let you do that once you've achieved that competency. And that's where we're complying with kind of the governor's directive to not impose burdens or restrictions, because there we're saying, look, we're going to give you the full license. You don't just have a addictions or a college counseling license, you have an LPC license. But before you go into these other areas, you need to be able to, you need to have done your homework and know what you're doing.
Yeah, Daryl, I viewed it as similar to law. I have a law degree. I do boring wills, estates, and probate. But I can go over and do criminal law, but I would have to really do a lot of ethical preparation before I head over there. And there's no specialty area for a law degree. It's just generic, but I've selected my lane, and that's where I'm at. And that's kind of what kind of helped me come around on getting my head around this. Is it's very similar in this case. Dr. Amuna, I think you had a question. Go ahead.
Yeah, so Dr. Taylor, the way that you described it gives me a little bit more solace, a little bit more confidence. But I know that we are relying heavily on our ethics and the honor system of the individuals coming in. And so as long as there's a concept of policing on the back end, again, I kind of have some solace because I'm thinking, I'll play the role of devil's advocate. You know, you come in as a school counselor, you get near Fort Hood, you realize that there are a lot of veterans, PTSD, blah, blah, blah. You hang out your shingles and just say LPC, and you do that work. And then it would be on the constituents or your peers to say, hey, you haven't done that training. And then eventually it gets to us if people are not ethical about staying in their lane.
Absolutely, and that's a good point. I would just say I am an absolutely horrific couples therapist. So if you want your marriage to fail, you should definitely come see me because I'm terrible at it. I'm terrible at it. Now, my license does give me the ability to do it, and I think arguably I'm competent in it. I have CEs in it. I took classes in it. I have experience in it, but I'm bad at it. It's just not my skill set. So I don't do it. You know, I refer out to other people because that's what we're supposed to do. Not every client is the right fit walking in the door. But we as the board run into the risk of getting too into the weeds, of micromanaging too much of it. That's part of how we had this huge problem for 5-6 years ago, where people were waiting months, years even to get licensed because of this kind of in the weeds sort of thinking. And I don't think we've had an explosion in complaints since then. So it seems to me that if this person has an accredited degree in some form of counseling, and then they want to come and get licensed, and then they want to pass the NCE, and then they want to go through 3,000 hours of supervision, we need more therapists.
Thank you, Dr. Taylor.
And I mean, these are good programs. Like this is not they're being well educated, right? Being very well educated.
Go ahead, Dr. Bradley.
The provost who spoke, if I understood and heard him correctly, said that they had made changes to the academic requirements of their program. To me, this reinforces the concept that programs have to make sure that they are preparing students for the academic requirements as listed in 681.83B, which, if I heard him correctly, I don't know what changes he was referring to, but I think this is a reinforcement for programs, but I'm not sure that all programs will do what he said his program had done. How do you handle that?
Go ahead, Provost D'Agostino.
Yeah, I can. I'll start and then I'll hand this off to Evan Spears. So It is an obligation of every university, every program within that university to continually evaluate curriculum. That is a given, and it is something that every university must do. If they're not doing that, they're out of date and they run the risk of creating the challenges that I've been listening to this board discuss right now. And I appreciate the conversation because what I'm hearing is an alignment with most of the processes across healthcare professionals and even other disciplines to ensure that we are adequately preparing students and ensuring that they are accredited and licensed so that accountability can be maintained. Now, with that said, we did actually look at our curriculum. We are very clear and we absolutely believe and know that all required elements of the accredited program were delivered. However, we did take a look and see, just to ease the process, we packaged it a little bit differently, again, maintaining the highest learning sciences standards. And so with that, why don't I hand that off to Dr. Spears?
Yes, the specific changes we put in were started this semester due to we were seeing that these programs were now being counted as counseling related and had to have a specific course in each of those areas. All of the content areas had been covered throughout our curriculum. However, there were two areas, the marriage and family and the abnormal behavior, that had been integrated through multiple courses. So the change in curriculum we made as of this spring was not a change in any content area, rather was pulling those out of the multiple courses and putting them into their single courses in case the licensing board continued to call our programs as counseling related, we would still meet we would be able to meet the standards. Yeah, and back to you, Dr. Higgins.
Thanks. And so this is an important item here based on this discussion, because as the rulemaking committee has been evaluating, we have accreditation standards that are dictated by a national organization that's being adhered to, and appropriately so. The curriculum is defined by those accrediting bodies that allow us to then generate the best model to deliver. Delivery is what changes between schools. We believe at TTU-HSC that our delivery model is exceptional. And we know that because our students do extremely well on national licensing exams, board exams, across all of our disciplines. However, my job as a provost is to continually evaluate that process so that we maintain that high standard. We have to maintain that high standard because at the other end of what we do is patient care. My penultimate job is to graduate the best student in those fields. The ultimate job that I have is to take care of patients through them. And that, in all honesty, is the standard that is set at every university that's producing professionals that are going out and taking care of patients. So we will be looking at our curriculum. We will be looking at our delivery models, and we likely will be changing over time as we see that we need to do that, which is actually an accreditation standard and a Texas Higher Education Coordinating Board standard, continually evaluating, modeling, and adjusting so that our standards not only can be met, but excellence can be achieved.
I'd like to just finally add that when we did make the changes for these two courses, we were in close conversation with KCREP, which they said there was no significant change. That did not fall under a significant change because we were changing no content area. Rather, we were just changing, as Dr. Iacono said, delivery method.
Thank you. Dr. Bradley, any follow-up questions on that?
Well, I certainly commend TTU-HSC for doing that. What worries me about all of this, they did it. But will other programs, and I know what they should be doing and everything, but will other programs do the same thing? And what sort of safety will we as a board have? Because they changed theirs. Okay, when it was being considered as counseling related. But what assurance do we have that other programs would be that ethical and would change that unless there was something called on the board? That's a question. It's not an accusatory statement. So what I'm saying is they did the right thing, in my opinion, by pulling those two courses out. And our program at TTU has had to do the same thing. There was a time that we were infusing, that was several years ago, ethics, and we realized and we pulled it out. Now we have two separate ethics courses. But what kind of assurance, like if a program isn't questioned about this, what kind of assurance do we as a board that other programs who are not being questioned will continually do the right thing? And again, I'm not accusing any single program. I'm merely inquiring here.
Go ahead, Brenda.
Okay, so I needed to sort of sit back and just listen to the discussion, and I am part of the rules committee. And so as Dr. Taylor was saying from the very beginning, you know, we have the rules, they're there in place. I think they're pretty clear. I think what's happening is as you have a change in the titles, like the college counseling, you know, we take a look at that and wonder again, you know, did you meet the core areas? You know, did they get enough, you know, in their subjects to pass this exam, and so on and so forth. I think you're doing a good thing. It almost to me sounds like Texas Tech is maybe setting a trend, and maybe in the future we're going to start to see more and more universities, you know, going this way, heading this route. I still feel that there isn't many changes that need to be done to the rules, at least not this one in particular, because I feel it's clear. When you talked, Renee, about you used the word packaged differently, and then there was mention about marriage and family abnormal and sort of being taken out and put into other courses. Are you, and this just again, just the question, if I'm thinking about the university offering college counseling, are you saying that the curriculum that's being offered meets that full criteria? And if so, why is it named college counseling? This is, I think, where I'm confused, because when I think about my license, and again, it's general, and I think about the public, and they're looking up somebody who is coming to me for counseling, and they're depressed, and you've got me, LPC, and you have Jane Doe, college counseling, which one would they come to for depression?
Are we still on? Are we unmuted? Okay. Yeah, so I think these are all great questions, and I appreciate the opportunity to engage in this dialogue. Dr. Bradley, I think one of the things, and then I'll come back to this specific question. One of the things that you had mentioned was our changing of the curriculum, and I appreciate the, again, opportunity to discuss this, because the change in the curriculum delivery is actually policed by the individuals within the school first, and then the accrediting body, but not how it's packaged. In other words, if we're meeting the accreditation standards, we're meeting the delivery of specific content items that are necessary for that degree. That's what's outlined. Universities and schools need to have the opportunity to use best practices, the learning sciences, and be able to evaluate and feed back into the system change to ensure that that is occurring. The way that we police this is actually looking at assessment throughout the course delivery. So however long a program is, students have to be assessed. We evaluate those assessments to see if the content is learned. More importantly, is that it's retained. And that validation comes when they take national board exams. And so we're constantly reviewing the assessment tools that are given to us to decide the best way to deliver. It would be cumbersome, at the least, for a licensing body to dictate how curriculum should be delivered at the university level. And I'm not saying that to be judgmental. I'm saying that it would literally stymie the process of content delivery at a university. Universities are designed to be able to deliver in the best possible way for the most retention, for the safety of those people in the health professions fields that they are treating in the future. We're actually, and I'll give you an example, not related to this. We are actually doing a pilot right now that is turning the way we train nurses upside down. And we've gotten approval from the accrediting bodies to do this because we were able to demonstrate clearly that the content is not adjusting, only the way we're delivering it, because we believe, and early studies are suggesting that this will be a better way to deliver than how nursing education at the BSN level was delivered for the last 2 decades. We have to have that ability. The only people that, or how that gets policed is through the accrediting body to ensure the content is still being delivered. So I don't believe that it's within the purview of a licensing body to change how it's packaged, but rather that it is delivered. It's an important point because that's crossing into the whole purpose of a university.
You're on mute, Dr. Ted.
Again, always on mute. I really appreciate that view of it, Provost. This is, I think, was in line with our thought process when we created 681.83A several years ago, because we were seeing the radical delay that was occurring when we were trying to individually count out the delivery system. And so I appreciate that view of it, because that did create a large backlog for staff. Because I mean, we sat, I'm sure Dr. Bradley remembers as well. I remember sitting in back-to-back 10-hour meetings, filled with auditoriums full of people that had academic issues, that were arguing that they got that material just packaged in different courses because it was creating issues for each individual university and school. So I really appreciate that view of it. And we decided, as a board, as a body, to trust our accrediting bodies to do their job. That was the discussion we had in creating 83.A, was that we will trust the accrediting bodies to do their job. And I think the only reason why we're having this discussion about these particular degrees is because staff viewed it as counseling related instead of a counseling degree. And I think 83A says that we count it as a counseling degree. And I think if we want to have the discussion of, is 83A too broad or does that need revision, we can have that conversation. And I'm definitely open to that. But as it stands today, as is the rule that we created, I think it's very clear that this is a counseling degree and that we should move forward with that. I think in fact, actually, I think the rule requires that we do. I think we are moved to do so.
Brenda, was your question answered?
Are we still on?
Sorry, I was muted. No, it wasn't, but that's okay. And I agree, Dr. Taylor, I think that everything that the universities are doing, they're doing well. I just feel that I, number one, want to make sure that things are clear and that we're not just constantly changing rules to adapt to titles and changes of the university. I don't want to get caught in that. I feel that when I look at the rule, it's clear. Period. That's it. That's just where I stand. Thank you.
Brenda, I agree with you on that. I come from this from the public member perspective, but I also come to it from a lawyer perspective. And I read the plain language of the rule, and it says, degree in counseling from an accredited school is presumed to have satisfied the academic course content. The rule does not break it down by specific specialty areas. And if when they had made that rule, I assumed that was discussed and it was left out. And so I have a problem breaking down degrees by specific specialty areas when our rule doesn't do it. Our rule under the plain language, it says from an accredited school. And the lawyer in me it has to go that way, but also really the public member in me, just it seems pretty straightforward. And yeah, I realize that there are all sorts of nuances to counseling and all the lanes created by specialty areas, but we don't do that in the rule. And I'm just going with the plain language. And if that is if we determine that we have a problem with that, then we'll tackle that later. But that's not what it says here.
And we don't want to micromanage as a board. Now we're just going to micromanage all of the universities and tell them exactly what they need to offer and how to, we just don't have that time. And that's certainly not our role.
Well, I think the most likely way that we would micromanage would be to saying yes to this specialty area, no to this specialty area. And we have no appetite for that. We're okay with accredited degree in counseling. At least I am.
And Mr. Chair, the staff already has a definition to go off of in statute with 503.003B3, which just says for these purposes, counseling means this. And in gist, it just says a therapeutic relationship using mental health, human development principles, method, techniques, psychotherapy to achieve mental, emotional, physical, social, moral, educational, spiritual, or career-related development and adjustment of the client through the client's life. And I think if you just read that brief description and say, okay, is this addictions counseling degree doing that? It clearly is. And you have a clear directive on that. That's obviously a counseling degree.
Go ahead, Dr. Bradley.
I agree with the provost statement, in terms of delivery. I think he made a very good point. I agree with what you all said, but I do want to come back, and I think this is something we need to tackle. I think that all counseling programs and counseling related need to have the coursework that's listed in 681.83B, but I realize that's something we need to tackle as a board, and that there's not time today because those courses are important to the delivery of good counseling services. And that worries me. And so I'm just going to say, I think this is something that we need to discuss and come to terms with the board. But I realize we have what we have to deal with today, but that doesn't mean that we can't deal with it later on.
I want to hear from our public members. Vanessa, Pastor Roy, like I said, you're not going to approach this like an attorney, but you're going to approach it as a public member who's tasked with protecting citizens of Texas. Does this change in, it's a change in the directive on how we or how staff will interpret degrees? Does it raise concerns for you? Do you believe that we're creating a risk to the public Personally, I do not, but I've done a lot of thinking on this. I've done a lot of research. I don't, but our job as public members, and trust me, I always want to hear from you guys on these issues. How do you feel about it? Where are you sitting on it?
Well, my concern would be similar to Dr. Bradley's, in that down the line, we may have to come back and look at the specifics of a particular degree plan, or the outcome of whether or not a particular counselor is able to counsel in a specific area. I have some concern with that, but right now, I think we need to follow the rule that's written.
Thank you, Pastor Roy. Vanessa, anything to add to that?
Not to add to Pastor Roy, but just to the discussion, I don't really have any personal concerns about it. If I were on the client side and my counselor had, he or she was licensed by an accredited university, he received his license, I would be totally fine with that. I don't even know if I would be interested in asking him or her to drill down into their coursework. I don't think that would be important for me, given that I'm dealing with a life issue. If that person is licensed, they have a reputable practice, someone has referred me to them, there's chemistry there. You've got to trust the system. You've got to trust something. And I believe that the schools have done their job to prepare them to deliver this service. And I also believe that just their own experience, their day-to-day experience in doing this job and becoming very adept at the breadth and depth of their discipline makes them a very credible person. And so I don't know that I would really nail them over their coursework. That's what that would be my thoughts about it.
Thank you. Dr. Bradley, can we alleviate your concerns if there is if we keep it in mind for analysis in the future on whether we like the language of the rule as written and what it's doing? I mean, because right now we have a rule on place, and you seem to be indicating that you understand that the rule is written this way, but maybe it doesn't exactly do what you want, and that you would like to take a look at the rule language in the future. Would that address your concerns?
Yes.
Okay.
I just, as I said earlier, I think those courses that in 683.83B, I do think they're important for all counselors. So yes, I understand we have what we have today, and that's the information we have to deal with. But I also understand that, I've been in the counseling profession. I've seen a lot of changes back to the days when I was president of the American Counseling Association. I saw a lot of changes in the field then. I see it now. And so I think we as a board need to realize we're in a changing society, and basically what I'm saying, we need to take a look at that. And I think what you suggested is good, as long as we don't wait too long.
Okay. Janie, I think you had your hand raised. Can I add something there?
Yeah, Chair Haber, thank you very much. And this would be to all of us to remember is that the academic coursework is one layer of the licensure expectation. And for the other members of the board who were not in that rules committee, another thing that we were given that we looked at were the breakdown of the NCE, and I always forget the other acronym, but the two licenses, I'm sorry, the two testing bodies that all licensees go through as well. And it's broken down by school in terms of the number of individuals who are taking and passing and things like that. And that was one of the things when I reviewed that data, that there are schools out there that are graduating individuals who are not prepared to pass. And so that's, we have that academic piece, but we also have the testing piece. And then they come into that supervision piece. And I think most of the professional members on the board, if not all of us, we're supervisors, and we understand when we get a new licensee in, we understand the growth curve that's going to be ahead for them. There's a lot to come that is in that practice piece that didn't come through the theory piece, which is that academic. That's just one of the layers. And so I think it's looking at the totality of how to become fully licensed, and the academic piece gets them to that associate, which is a provisional license, but bringing them into the field so they can then come through the practice piece. And when I think of my own career, there was a time when I worked at a psychiatric hospital, and there was a big learning curve for me going into a psychiatric hospital, and what were those expectations and things like that. And that ultimately is not, where I've chosen to settle my career. But I remember that piece of learning that came for me from that experience. But I had to have that license to get that job and then have that learning, that growth curve ahead of me. And so and I appreciate Texas Tech University and the hard work and research, and the way you delivered and packaged that information for us today, that what we're talking about is that broad general license opportunity to then have those specific growth curves in our field. And some of it's going to be in the clinical piece. Not all counselors work in the clinical piece. We know that.
And Jenny, I think it's great points all around. And I'd also like to, just discuss the individual that's going to school because he's really, or he or she is really, inspired to become addictions counselor, but we don't have a license for that necessarily. So they want that master's degree. They want to go a step above the LCDC. They want to be a professional counselor, but really want to get into this field of knowledge in their academics. And I think that's great. If they already know they want to do that, that's amazing. And also, 85% of our complaints come from relationship and notes, relationship crossing and records issues. Not this person was not the right counselor for me issues. Our duty here is to set and maintain the minimal standard, not to determine what school is the best school for you to go to, or what therapy is the best therapy for you to do, or which therapist the client with depression should go to. Our place is just to set that minimal standard to make sure people are not having relational boundaries crossings and that they're doing their notes, and that's, I think, kind of when we get into the weeds of is this degree offering this exact course the exact way that we want it offered. Like we don't go in and inspect the courses and say, well, which book are you using? How are you teaching that material? We can label the course whatever we'd like, use whatever textbook we'd like. We rest on the accrediting bodies to review that. So I just kind of want to keep that in mind as we move forward with that larger discussion, if we choose to engage in a revision of 83A and B, is that, what's our main purpose here and what are we really protecting against? Because I don't think there's an academic course, really for relationship crossings and doing your notes the best. It's not really a theories thing. That's a practice thing. That's what you really develop and grow through your associateship, right? Sure, we can teach the fundamentals of it, but that's something you really learn in the field through that 3,000 hours. And we still have that 3,000 hours. And, you have continuing education after that. So there's just so much more for you to grow and learn beyond just what we learn in the classroom.
Thank you, Dr. Taylor. Provost D'Agostino and Chair Spears, you have your hand raised. Is there anything that you would like to add?
I did want to just follow up on what Dr. Bradley had mentioned. If in the future you are addressing, make sure it's right, 681.83B, that I would respectfully request that you refer to the information as course content or curricular content and not specific courses, because we don't want to limit the ability of a school, an institution, a university from being able to develop coursework and innovative solutions for delivery. It's just a request so that we don't walk into challenges of being mandated for certain types of coursework. Remember, as I mentioned before, that is the purview of an accrediting body and recommendations of the Higher Education Coordinating Board. Content and mastery of that content and validity of that mastery is what has to be evaluated at a licensing board level.
Thank you.
Thank you.
Ms. Hall.
Vanessa, you had your hand raised. Did you have something to add there?
Oh, I did, but I think it's beyond the point. I was just going to say that as I listen to the discussion and I think about going to a counselor, I recognize that one thing that, because I've gone to a counselor before as a client, and the one thing that made me very interested, it was the chemistry. It really wasn't all the theory. It was just the practical anecdotes and the things that they shared with me and how to cope with certain areas that I was grappling with. That was really the overriding reason I continued to see that counselor. I never, until this moment that we're having this discussion, realized that much of their theory never came out in our sessions. The academics really never came out. It may have been a catalyst, but it really didn't have the practicality in my sessions. And so I'm listening to the professionals, to the counselors, to the lawyers, to the doctor, and I'm saying as an individual, I don't think when people are in that type of crisis, they are thinking from that context, not that it's not important. And from your side of the table, it's very important to prepare, to give adequate service, to be provide information that's safe. But I also think that schools are doing the job to get you to the point where you can take the license. If you pass the exam and then you're supervised and then you're doing CEs and then you're doing your own everyday, day-to-day work, I just think that as a client, you realize that this has been a safe passage for me to trust this individual to really help me with the life issue. That's kind of the epiphany that I'm having right now as I listen to this discussion, not even as a board member, but I'm like, oh, okay, now I realize going to that counselor, this is kind of the backstory to it. And I feel so honored right now to be a part of this discussion as an individual, because now I recognize, had I been so interested in all the academics, which I probably didn't even have the competence to know what to ask in terms of what classes you took, I wouldn't have received the help that I got. And I think that that's a very important distinction for me right now.
Thank you, Vanessa. Board, is there anything else to add before I summarize this discussion? Okay, in summary, it's my opinion that we do not have the wherewithal to make a rule change today, but there is some interest in taking a look at the rules in the future to see if they are doing what we want. Since Texas Tech's petition does ask for a rule change, Patrick and Daryl hop in here, but since they asked for a rule change, I believe that we are obligated to we would have to deny the petition since it's requesting a rule change. But at the same time, we can issue a board directive to staff for how to evaluate accredited degrees from today forward.
Yeah, I think the petition should be denied for mootness with the understanding that the directive to staff will be to apply the rule as written, which gets us to the same point I think that Tech was wanting to get to via the rule. Well, I know it does. It gets us to the same point they were wanting to get to through the rule petition. So really what we're doing is we're doing away with the historical interpretation of that rule, and we are now applying the rule as it's written.
Okay, thank you, Daryl. I just wanted to make sure I had that clear procedurally. So at this point, we need a motion.
I move that we deny the petition by Texas Tech University due to, as Gerald said, mootness.
Daryl, do we need to split this into two separate, or can it all be combined into a single vote?
You can combine it in one vote.
And that we apply the standing rule as written.
Second.
Okay. Janie with the motion, who seconded? Dr. Taylor? Okay, Dr. Taylor with the second. Right, before we vote, is there any further discussion now that you know the specific motion that we need to vote on? Anyone? Okay. We will go ahead and vote. I'm going to need everyone to raise your hand. I want to make sure I have a specific tally on this. Does anybody need the motion summarized one more time? Okay. All in favor of Ms. Stubblefield's motion that we deny the petition from Texas Tech and that we direct staff to now interpret 681.83 as written, please raise your hand and signal with aye.
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 Okay. That's everyone. I don't believe there are any nay votes. Thank you, everybody. We're about due for a break, but I think based on that result right there, that affects number 5. So maybe we should take a look at number 5 so that those people that are waiting do not have to wait through our break. So Christina, will you take this and kind of explain what we do now?
So 3 of them relate to this issue. So that's going to be B, C, and D in your packets. At this point, I don't know if you want to hear from the applicants or not. But otherwise, I don't even think we need a motion to be made. If we just interpret the rule, as it's written, we can go ahead and move forward with theirs, continue the application process. So would you like to hear from them at all?
Daryl, can you speak directly to the 4 applicants and let them know the implications of our vote and how it affects them?
Yeah, for Ms. Bing, Ms. Crow, and Mr. Penrod, what the action the board is taking here today, what that means is your degrees will be viewed as counseling degrees, and the deficiencies that you've been notified of in the past are now rectified with regard to that degree. So we will move forward. You will not be hung up by this. There's not going to be a deficiency in this regard on your applications. If that was your only deficiency lacking, then your license is going to be issued. So staff will reach out to you to make sure, confirm with you if there were any other deficiencies, but you should be good to go now. I think the other one, Rossi, Christina, that's not a degree deficiency issue.
That is
though.
correct. That one is a different issue.
Okay. So that one you'll still have to tackle, Mr. Chair.
Correct.
Okay. So B, C, and D, they are essentially satisfied. With A, Ms. Rossi, if she is present, she can speak.
Okay, correct. And she does have legal representation, which I believe is Amanda Ellis. So let me go ahead. Ms. Ellis?
Yes, good morning.
All righty, good morning.
Before she takes over, do you mind just giving us a breakdown of what the issue is and
Sure.
what's being asked of us today?
So related to Ms. Grimaldi's application, it is she was found to have only 25 graduate hours at the master's level, and 162 hours were bachelor's. So based on the evaluation that was completed, staff are not able to show that there are enough graduate level hours. This was reviewed by an applications committee member as well, which agreed with staff's review. And at this point, the applicant has appealed that denial and is here with representation.
And was this reviewed by I forget his name, Dr. At Texas University? That typically does the out of the US?
No, we do not use him anymore.
Okay.
No, I think this was a West report if I remember correctly, but let me look through it real quick.
Okay, but Christina, was it reviewed by somebody who reviews foreign degrees?
Yes, it was. It was completed by the credentialing is by Spantran, the evaluation company is what it's called. SPANTRAN.
And this is from Brazil?
Yes, that is correct. It's page 26 of your board packet, where the review is first documented. So based on this evaluation, and staff did, we asked for as much documentation, the course descriptions, as much as we could to try and approve as many courses as possible based on descriptions and whatnot. But with this review, we just don't see that there's enough graduate hours. And so, and in addition to not having enough hours, they're also deficient in theories and lifestyle career development.
Okay.
We have Amanda Ellis, correct?
Yes, and
Counsel?
she is on, correct.
Yes, and Miss Grimaldi is also remoting in from Brazil. If you see her there.
She has the opportunity to speak if she would like to.
She does. I'm just going to briefly recap and give you a little bit of information, and then she'd like the opportunity to address the board. We appreciate it.
Amanda,
Council, if we can keep it to 3 minutes each, if possible.
Absolutely.
Thank you.
Amanda, I hate to interrupt. Do you know, is she calling in via phone? What's she?
I see her on here.
Oh, you do?
live.
Okay. Okay. I'm sorry.
Thank you.
Did you, Ms. Ellis, did you want to go first or did you want to let the client speak first?
I'm going to go first if that.
Okay, go for it.
Again, thank you all for the opportunity to meet today. My esteemed law partner, Laura Diamond, put this together and she couldn't be here today. You've got the written supplement that kind of outlines the responses to the board's reasons for denying the application. So we're not going to repeat that. But I think it's important to note that Ms. Grimaldi has more than met the educational and practicum requirements for licensure as an LPC associate. She's got at least 61 graduate level hours and more than 3,000 hours of supervised practicum. Our biggest difficulty we've got here is we've got a Brazilian education system that is named differently, ordered differently, packaged differently than we have in the US, but it's nonetheless valid. Ms. Grimaldi's been licensed and practiced as a psychologist for 11 years in Brazil. She's got significantly more education and expertise than most applicants do for an LPC associate. And keep in mind, she's not asking for full licensure. She's asking for the opportunity to prove that clinically she is going to pass muster. She has a supervisor, Jennifer Buffalo, ready to work with her to do that. And so we're respectfully asking the board to exercise its discretion to find substantial equivalency in what she's provided. Of note, you have a bachelor's program that is much more robust than we have in the US. So when you graduate from this 5-year program, you are fully, that you are ready to be licensed. In fact, Brazil doesn't even require master's courses, but Ms. Grimaldi has sought those out of her own. Those master's programs are really more research focused. And so the difficulty with the courses is that some of these courses aren't even offered at a master's level. They put them into their bachelor program. And so I think that's the difficulty. They've got a program at a bachelor level that is tantamount to what we would do at a master's level.
All right, would you like Ms. Grimaldi to go ahead and speak now?
Yes, Ms. Grimaldi.
Ms. Grimaldi, are you there?
Yes, I am here.
Thank you.
Yeah, we presented a review from Espantran, and they reviewed the number of the credits, and I proved that I have 61 credits, and I finished my master in Brazil, and I have two kinds of specialization after finish my bachelor. But I understand that in Brazil, our education is very different than here in US, and we starting attending patients in the 3rd year of the college, and when finish our bachelor, we can receive a full license, and because of that, my education is very different. But I present a lot of documents, and yeah, I am very, I've been living here in Texas since 2015, and because my husband was transferred by his company, and now I'm waiting only for starting working, come back to that I love to do. And I am open if you have some questions about my experience or my knowledge.
Thank you, Ms. Grimaldi. Go ahead, Jamie.
My question, Ms. Ellis, I heard you say that she was licensed as a psychologist in Brazil. Has she pursued that psychology license in Texas?
She has not. She's seeking to be an LPC.
Okay, because I mean, that's a different license, and I don't know what their requirements are, but ours are different. So her license in Brazil, if it was as a psychologist, I don't know that it would be equivalent to a professional counselor in Texas.
Oh, understood. And we're not asking that the license be found equivalent. It's just an example of how this education works so that you come out of a bachelor program kind of in a position that you would be after a master's program here. And that's merely also presented just to say that she's an experienced mental health professional, but we certainly appreciate that this is a distinct license.
Dr. Amuna?
Yeah, my challenge is just kind of an equivalent thought process. If we were to bring it to the United States, if we had a student who went to school in Louisiana and they went through an intensive bachelor's degree program with the amount of hours that the individual here has, we would still run into the same challenge with them, even if they were in the United States. If they went through a bachelor's program that was as tense as hers presents to be. I went through the transcript. There's a lot. But even if we had an individual who was from Louisiana who went through intensive training at the bachelor's level, we would still find ourselves here with needing that master's equivalent information, even if they were here in a state here. And so that's kind of my challenge of translating a super bachelor's degree, which it seems that, she went through. Again, it's amazing, actually, some of the courses that were taken at the bachelor's level, but how will we handle that if that was an individual from Louisiana who only needed 50 credits to get a bachelor's degree and took 150 credits specifically related to our field, but they still ended up with that bachelor's degree, how would we treat that candidate before us? Is the mental challenge I'm kind of going through.
My question would be, why did we do any course mapping before we decided to take the degree? And I guess before we decided to, I'm assuming that you're going to be moving to the US, is that correct?
Can I answer?
Yes.
Yes, please.
Yeah, first I would like to answer Ms. Stubblefield about psychology and counseling. In Brazil, we don't have a bachelor and we don't have a license as with this name counseling. We only have psychologists, and as a psychologist, I can work as a test and work as career counseling and as a clinical. And because of that, after I finished my bachelor, I did one specialization in clinical practice, and I believe I choose apply as a counseling here because my experience and my knowledge is more fit more as counseling than as psychologist, because my practice there was in counseling psychiatric patients, working as with patients that suffer sexual violence and things like that. And I believe my experience fit better as counselor here and as social work, not as a psychologist. Because of that, I apply as counselor. Do you understand? Mm-hmm. Okay. And
Yes, thank you. Thank you very much. I appreciate that distinction.
Okay, thank you. I'm sorry, Mr. Taylor, could you please repeat?
So my question was more of a practical one, which is, I'm assuming that you're moving here. Did you look into the academic requirements in advance? But before you went into the academic program, did you reach out to the board for guidance on if these courses would work or what you would need to do in advance?
Yes, and I understand that my graduate level as my post-graduation is very equivalent that your requisites, and I send my documents, I apply, and I did the NC, and I understand that, and I was approved.
Amanda, I'm not sure she's understanding my question exactly.
I think that perhaps you're asking, did she think about this, that she might be going to the US before applying? Think about what course requirements, is that what you're asking?
Yeah, I guess kind of like, how did we get here? Was this part of was her intention to go to school in Brazil and then move here, or is this just a random occurrence?
No, I moved to US because my husband was transferred from his company. And and I finished all my education in Brazil, and I am working in Brazil, and after we moved to US with all my family, and now my kids are grown up, and my son is graduating in UT this semester.
So you were,
Does that answer your question, Dr. Taylor? I don't think she had the opportunity to plan because this transfer wasn't anticipated.
okay. So what, are you in the US now or you're in Brazil?
Now I am visiting my mom in Brazil. Yeah.
You live,
Yeah.
you live in Texas.
Yeah. I live in Texas, in Austin, but I am here this week, and I am come back in next week to Austin.
Did you apply to the psychology board?
No, because to be a psychologist in US, you need to PhD, and I have.
No, there's also the opportunity to be a licensed psychological associate as well, which might be I don't know, Daryl, that might be an easier path for her or not, but there is that option as well. Since your degree is in psychology, that might be a little bit easier for you. I'm not sure.
Yeah, but when I talk to, I have some friends. I have a friend that she's a social work and another is a psychologist. And I talk to them and I understand that my experience and my knowledge, because I work many years as counseling, my education is more interesting for me apply as a counselor.
I have a question, Mr. Chair.
Yes.
And it's not for Mrs. Grimaldi. It's maybe more for Daryl, Christina. I'm just a little confused. I'm looking at the documentation where it's got the practicum graduate internship document, which is filled out April the 11th. She is to be supervised by a psychologist?
Yes.
No.
Yes, because in Brazil we don't have a counseling license. We have doctors that do counseling, and we have psychologists that do counseling. And during my post-graduation, I receive a lot of supervision from psychologists that has PhD.
Was this, Christina, the practicum, was this approved? The internship, or is it just a
what
copy
page
of
are you looking for? Are you looking at? And what I'm thinking is this was practicum that she gained in school, so we don't have any jurisdiction over the universities who supervises them during their practicum. But when they have to get their hours as an LPC associate, that has to be under the LPC board supervisor.
And I think this is where I'm confused. I went into the folder under her name. I pulled up the graduate internship, and this document that I'm looking at is not a 3,000 university. This is she did 670 direct client counseling hours, 738 indirect, for a total of 1,408, supervised by Eva, a psychologist from Brazil.
Yes.
But it's our form.
Okay, let me look at it.
So that I'm so confused.
No, that's okay. It kicked me out, so I'm getting back into it.
Okay. Does anybody else see this form here?
Is it under the supplemental, or what is it under?
Yes, ma'am. Yes, that's what it is. Mm-hmm.
Okay.
What attachment number is it, Brenda? What attachment?
I just see 1 of 2. Scott Grimaldi's supplement PDF. It's Texas Behavioral Health Executive Council. It's our form.
Does it say what page?
What page?
I'm just on page 1 of 1.
Oh.
Attachment 9.
So I'm looking at that and I'm thinking, well, wait a minute, that looks to me like, no, I'm not gonna even go there because I'm so confused about it. It's almost like we're having a conversation about.
Okay, so it's page 40 of 42. It's in the supplemental, so page 40.
Okay.
So let me look at this.
Okay.
Yeah, so this is the practicum which she would have done at the university. not the hours that she has to gain under her LPC associate.
Okay.
So what, is there like a specific question?
No, I was just confused because typically, the practicum for university is not 1,400 hours.
Yeah,
Plus the fact that the person supervising was from Brazil. So I'm just
Yeah.
trying to figure out how that all.
sure. And I think that's what, Miss Ellis is saying, that she's had even more of that practicum experience than a typical LPC associate would. And that's not the issue for us. It's the
Right.
issue of the graduate level hours,
Okay.
master's level hours.
Well, I guess the only thing I need to say is just, historically, we've had situations like this before. Again, just as Dr. Muna mentioned, if it was somebody from Louisiana or wherever, we've looked at it as well. And it's very unfortunate because, we're looking at the transcript and obviously there's a lot of great classes that she's taken, but we have rules. There are rules. And I think she could make a great licensed professional counselor, but we have rules to follow on this. And, it's just an unfortunate case. I know that she didn't plan on moving over here, but, there are classes that need to be taken. So it would be hard for me to approve something like this when historically I've sat on this board and not approved others.
Dr. Amena?
And I will share, just for clarification and appropriate self-disclosure, as we say in counseling. I'm licensed in several states, and I remember being licensed, I'll just share, in state number 1, being fully licensed as an LPC, being an LPC supervisor here in the US, and moving one state over and not being eligible for their LPC license because I was missing, and I'll say the class, I was missing an advanced abnormal psychology for that state's licensure board back then. So I was fully licensed in the state here in the US. I was a licensed professional counselor supervisor in said state in the US, and moved over one state. And because I did not have that advanced abnormal psychopathology class, I had to take that one class to qualify for licensure in that state. And I think the kind of, to mention what Brenda mentioned, is it's unfortunate that this individual has gone above and beyond the bachelor's level requirement that I've ever seen, but still understanding that as a fully licensed person moving from state to state, having to take courses to meet that state rules, it's just something that I even had to go through myself.
And I wanted to clarify on the deficient coursework. So we showed theories, the lifestyle career development, and then also, if you see, it's not highlighted on your page 17 of the first packet of material for her. It says partial met. So she didn't meet enough of the social cultural family. So that one right now we would not be able to accept also. So it is 3 courses. So the theories, lifestyle career development, and the social cultural family.
Christina, but do we get to the 60-hour requirement?
No, she would still need to do that. So
Okay.
she would need, so part of that 60 would be these 3 courses would need to be in that 60, in the remaining.
Christina, is she gonna fall under the 60 or the 48-hour requirement?
Let me double check.
It looked like her degree was in the early 2000s.
Yeah, Daryl, two questions. One, how would first, has the academic committee reviewed this? The applications committee reviewed this?
Yes.
And this is the denial is from them?
Correct. They agreed with staff's.
Second, how would she was licensed as a clinical psychologist for 11 years in Brazil. How would the psychology board here view her applying for licensure?
She would not be eligible for a psychologist licensure without the doctoral degree.
Well, what about the LPA though?
The LPA, she's still going to have problems under the current LPA rule because it's a 60-hour requirement for that degree. And it also has some coursework requirement. Now, it's the 60 hours it's going to hang her up. Now, I will tell you the psych board is looking at changing that rule. There's an idea floating around now to allow for grandfathering of people that are correct, got their degree prior to a certain date, being eligible to be grandfathered in with less than 60 hours, kind of like what y'all do. But that's not the law right now. So
either way, she's going to have problems on both sides.
correct.
So she would fall under the 48. And she's completed, we are able to count 25. So if I did my math correctly, she needs 23 more master level hours, and 3 of those need to be in theories, lifestyle career development, and the social cultural family. One hour in each of those.
And we've given her a clear directive on that. I mean, she has a blueprint of what needs to be done in order to get licensed.
Yeah, I mean, she's received deficiency notices on which courses were deficient. But after this meeting, I guess it'll be, because it was denied by staff based on the coursework. So,
Yeah.
I mean, yes, she was notified of what the deficient courses were, if that's what you're asking.
And I mean, we have given her a do A, B, and C, and you now qualify letter.
Yes.
I think respectfully, we do need a little clarification about exactly what she needs. I understand with the coursework. When we're looking at that attachment 9, just to be clear, those were postgraduate. That was part of a professional improvement program at a university-sponsored program with IAMSE. And so we are curious as to whether that gets her that practicum. And if we are just looking at 3 courses, and that if that coursework alone would be sufficient to get her there.
So what I'm understanding is that the short answer there is no. Those 3 courses alone are not enough, that she's got to get up to 48 hours at the master's level. Now, that specific practicum, Christina, can you answer that question?
I don't see any reason why we would deny it. Let me make sure. Yeah, I mean, it's filled out by an official, credentialing. I think it's from the university. So I don't believe our rules say anything where we cannot accept the practicum from a certain, profession.
From a psychologist?
Yes, only the LPC associate hours that they gain under the board approved supervisor has to be an LPC board, an LPC. But the practicum is not specific that I'm aware of. So to me, we would accept she meets the number of hours that we would need under practicum. So to me, the practicum is resolved. It's only those 3 courses and the remaining hours.
Yeah, Christina, the practicum courses are left up to the school to
exactly
how they want to manage them. Because theoretically, the idea is that the practicum instructor is also supervising them. So
correct. So we don't have jurisdiction over the universities. So that's my understanding, that we can take whatever the practicum is that's from the university is, what we will accept. So I don't see any reason why we would not accept this practicum.
And another ask, if we're arriving at a consensus that she really needs to go and get that coursework, that 23 hours, would it be possible to put this application in abeyance rather than a full denial, such that as soon as she can get those master's courses completed, she can do that versus a denial, which is going to make her wait another year and start over?
That one, I'll have to, yeah.
How long has this application been pending? I mean, here's the thing, Amanda, the longer this, they have a year to cure any kind of deficiency or to complete all application requirements. How long has this app been pending? When was it filed?
I'll have to look it up. I'm logging in right now. I don't think so.
My concern is the longer these apps, if we extend the pendency of the app, that cuts against the agency on its performance measures.
Okay.
Now, in 23 hours, that sounds like that's going to take a while to complete that. That's not something you can you complete that in a year?
I believe that she can. Do we know how long the application's pending? I'm sure Laura has this at the ready. I know that the first denial came in February 7th, 2021.
Christina's looking it up now.
Yeah, I'm in there right now. The initial application was received July 30th of 2021.
So she's got till July 30th or 29th of this year. So I mean, here from a practical standpoint, we don't have to deny her, Amanda. We could just say, let the thing sit, let it expire, it'll go void. And then she doesn't have a denial against her, which we wouldn't report that anyway. That's not a reportable denial. She can just reapply, and when she gets the hours completed and submit that, because I mean, everything carries forward. So she's not going to lose anything.
Okay.
The only thing I'm looking up would be the national exam. Let me see when she took that.
Oh yeah, that does. They've got that 5-year limit on that. Amanda, do you know when she sat for the NCE?
Samantha?
Sorry, I took NC or before I start an application is around 1 year ago.
Okay.
I finish NCE, and the next less than 1 month I send in my application.
So she's probably got 3 to 4 years.
Yeah, if it was a year ago, she should be fine. Won't have to retest. It's going super slow for me, so I can't verify what we have on file. But if it was a year ago, then she should be fine with the exam, the national exam.
The only downside, Amanda, is she would have to pay a new application fee. That's the downside.
Okay, but I think with the clarification that we know that we've identified the coursework, and that's the issue. That's great. The practicum issues resolved. And so I think now she's got a clear path for what she's got to do to be licensed, and a time frame. I think that she can get it done. If we'll just let the application go void, as you said, that's fine.
Yeah, it's a no harm, no foul type deal. Just letting it go, letting it expire.
Daryl, I think that's the best result that we're likely to support.
Honestly, I'm not sure what else y'all can do. I don't know of another mechanism that you have at your disposal to rectify this problem.
We're being asked to determine that there's a substantial equivalency between undergraduate work and 23 graduate hours. I don't think that's going to happen.
Yeah, Mr. Chair, I don't know that we have the authority to do that. I think one, we have a evaluating body that's given us a directive, or it's given us an opinion, a professional opinion. Yeah, staff has reviewed it, and our academics or applications committee has reviewed it. I think we can just make it. I think the best thing we can do at this point is just make it as clear as possible what specific requirements she needs. So I don't know, Christine, if we can give her a summary letter, or just make it crystal clear.
Yeah.
A, B, and C, so that way she doesn't go out there and take the wrong course, or gets confused and can't get an answer. But just make it abundantly crystal clear, saying we've accepted all of this. Just go do these 4 things, what it sounds like, and then reapply within 4 years, so you don't have to take the NCE again, and you're good to go.
And to be clear, Christina, the coursework, it's like 23 hours, which is inclusive of these 3 courses. So those 3 courses will make up part of it. It's not 23 and
correct
3 additional courses.
Correct. But I'll work closely with you, Ms. Ellis, to make sure that we get you guys everything you need and moving forward on this application.
Thank you very much, Mr. Lynn. I appreciate it.
Yeah, and Mr. Grimaldi, I just want to say I know it's difficult, and I'm sure this is unhappy news today. I just don't see a way around this. I know it's very difficult coming in from another country that does not have a similar system to ours. We'll just do the best we can. So I'm sorry to send you back to school, but looks like you're going to have to. So please don't be discouraged.
Dr. Amuna, go ahead.
Yeah, I was literally going to add to what Dr. Taylor just said at the end. Samantha, your experience is wonderful. It's commendable. And I don't want this experience with our board to deter you from pursuing a field that you've done for so long. I think this is just one hurdle that will get you on your path to being a great asset to our state.
Sarah, you have your hand raised. Did you want to add something there?
Yeah,
Thank you.
I would like to ask, yeah, for me to do this kind of classes, I needed to go to the master. And do you think it is possible go to the master only to complete some subjects, some classes?
It is. Ms. Fazels, would you please mute your computer while you're typing? I think that's you, or maybe it's Ms. Ellis, one of you, please. Ms. Grimaldi, it is possible. It's absolutely possible. There are several programs that allow you to take courses piecemeal, especially if you share within the situation that you're in. I know there are several great online programs that'll be happy to help you with that. I'm sure there's a local university for you as well. And maybe Ms. Fazels has some information for us there. But yeah, so that is definitely possible, especially if you show them the letter stating this is all I need. They'll be willing to work with you there.
Will you intend give me a letter specifically show exactly what the classes I need, and I can show to St. Edwards, for example, to do only these classes?
Yes, ma'am. Ms. DeLuna will get with Ms. Ellis and they'll assist you with that letter. Yeah.
Mm-hmm.
Dr. Amuna, go ahead.
If I can help the applicant with terminology, one word that or phrase that you want to use with the school that you intend to go to is non-degree seeking student. They assume that everyone who kind of comes to the university is seeking a degree. When you're presenting your case to the university you choose to go to, let them know that you want to do a non-degree seeking track, which allows you to take courses at the master's level without all of the master's degree requirements, because you're not seeking the degree, you're just seeking the courses. So if you could use that terminology, non-degree seeking student, when you go to apply.
Dr. Bradley, go ahead.
I was going to say something similar. Some universities, just be sure that they understand that you're not seeking a degree, and some universities call it graduate student temporary. Just be sure that you're not in the degree seeking track is the important part.
Thank you. Now, Sarah, back to you. Did you have something to add to this?
Thank you. Just for the board's consideration, I wasn't quite sure if the motion was intending to grandfather her application to current rules. From my experience with the other boards over a period of time, life happens and the applicant may not be able to complete the coursework as quickly as they originally intended. And during that course of time, the rules change. And staff generally apply the rules that are in effect at the time that the application is received. So I just wanted to ask the board about that for you to consider that. Thank you.
I mean, we can't freeze. We can't say, take a snapshot and say, okay, applicant, we're going to apply the rules as they are right now to you, regardless of what changes the board feels need to be made, at some point in the future. Now, fortunately, LPCs have a rule that is pretty clear. It allows you guys to what Patrick and I call Frankenstein. your education. You can take your degree and add on components from other non-degree program, non-degree seeking programs. I mean, it's a pretty handy tool that y'all have that not all the other boards have. And that's been present in y'all's rules for as long as I've known y'all, way longer than that, I think. So I don't see that changing. I've never heard any discussions about changing that. So I'm not too worried about that tool being stripped away from this particular applicant if she finishes this thing within a year or 2 years. I can't imagine that part of the rule ever being changed. It's too handy of a tool to take out. So I don't really have a concern about the rules changing and then, kind of the rug being jerked out from underneath her at the last minute. But I also don't think this board can bind future boards. You can't do that, if that makes sense.
Okay, since we're heading the direction that we are, does this require any affirmative board action at this point?
No, sir. No. I mean, Christina will get with work with Amanda, get the letter sent out to her, let her know what she needs to do. And then she just needs to go do it and then reapply. I mean, it really is that simple. It's simple on our end. I know she's got to go back to school, but.
Okay. Board, we are overdue for a break. Let's take 5 minutes and then meet back here. Welcome back, everybody. We're going to move on to agenda item number 6. This is an agreed order and will be presented by Attorney John Bridges. So, Mr. Bridges, if you'll take over.
Yes, board members, what we have is Eric Enoch Escamilla, as the result of a criminal investigation, was required to maintain civil mental health observation. And in line with that, he's already met the education requirements. We are just allowing him to come in to parallel that civil requirement. And as long as that civil requirement is a part of his life, we were wanting his practice in order to maintain that. He has already had a similar agreed order with the psychology board for their psychological associate. And in fact, he is applying for that again, and that will come under consideration at their next board meeting. So this order, it basically parallels what has already been granted previously by the psych board, but of course, under your rules.
And John, just to stress, he does not have an actual criminal conviction, correct?
Correct.
Okay.
Is he currently LPC associate or LPC? I'm thinking associate, right?
He was a psychological associate. So this is the first time he's applying under the counseling board.
John, was he an LPA or just had he applied to sit for the EPPP and we approved him?
He was
He
just
never-
an applicant.
Yeah, he never attained the LPA license. I don't. If I'm remembering right, he couldn't pass the exam.
Okay.
That's what I'm remembering, but I know he didn't attain full, attain licensure under the psych board, but he had the same order.
And are we asking the supervisor to submit quarterly report? What are we asking of an LPC supervisor for this individual?
They would be required to do an initial report, I believe, within a month. And then after that, it would be
annual.
But he also has to comply with whatever term, like additional issues that the supervisor says you need to do X, Y, or Z. He needs to follow X, Y, and Z. And even if he gets an LPC, he still has to maintain supervision. So the supervision is continuous.
As long as he has the civil requirement.
Any additional questions? Any concerns? Christina, is he here or does he have counsel for him here?
I do not see his name listed. If he is here, if he wants to raise his hand. John, do you know? If
He did
was-
not have counsel, but after speaking with him, he said he was going to make himself available to answer questions if there were any.
I'm not sure if maybe he came in under a different name and that's why I'm not seeing him. So if you are on the call and would like to speak, please raise your hand on the Zoom function so that I can let you speak.
Mr. Escamilla, if you're on the line or on the call, can you raise your hand? Seeing nothing, Mr. Chair.
Yeah.
Okay, thank you. If there are no further questions, we do need a motion to accept this agreed order. Are there no motion to accept?
Chair Halbauer, I will tell you my hesitation to accept is that he did not come today. I'm just being honest. I would have preferred to have heard from him and his commitment to this order. Because I have not spoken to the individual. So that's my hesitation.
Janie, I agree with you. The fact that he was not represented by counsel probably means that he assumed an agreed order was a done deal.
So can this be tabled?
Well, before we do that though, he's not obligated to attend. And if he has worked with our attorneys to come to an agreed order, I mean, basically it's just the chair's prerogative to sign or not. I don't even know if we need a vote on it.
I just wanted to hear from him,
Yeah,
but I mean, it's really up to everyone.
yeah, he has spoken. He's spoken to our attorney, right? He's talked to you, John, right?
Yes, sir.
Yeah, so I mean, they're not obligated to attend these. If he's made his case known to our attorney has drafted an agreed order. I mean, we're just lacking a signature. This isn't a SOA hearing. He wasn't subpoenaed. He's not obligated to attend. Yeah, it seems kind of like pulling the rug out from underneath him if we've gotten this far. But my understanding is that this is it's an agreed order, so it just needs to be signed by the chair. Daryl, does this even require a motion? Patrick, does it require a motion?
I think it would require a full vote and a majority ratification, but you are correct. It's one of those things where he's not mandatory, he's not required to necessarily come. A lot of times when we work through these things, knock on wood, we haven't had one rejected yet, but again, if it's something that's really important, it can be tabled for the next meeting and ask that he do come. But we can't force him to come. You're right. We don't subpoena them to make them come to the meetings.
Yeah, and I mean, I don't know how this was presented to him. I don't know if it was presented that if you don't come, board members will be concerned because they don't have the opportunity to ask you questions, right?
That was not how it was presented.
It's not how it was presented. So, I mean, it seems unfair to do that. But that's.
Let me add one other tidbit to think about. I will tell y'all this is a highly, highly unusual situation with this applicant. Here's what we have to be mindful of. If we if this order is not signed, then our option is to deny the applicant, which he can then appeal over to SOA. And I'm trying to say this delicately. I feel like this agreed order represents a good deal, the best deal for the citizenry, this board, and the applicant. It provides the measures of public protection that staff believe are needed. It comports with a similar order that the psychology board, I'm not trying to cram what the psychology board did down y'all's throat. Y'all are two different boards. I get that. But if we may not be able to ensure to the same degree through this order public protection if we don't sign the agreed order. And I can't really say any more details than I can't get into any more details than that. And I apologize. I'm not trying to be evasive or cagey here.
And I
It's just
understand
the
what you're
delicate
saying.
nature.
I understand what you're saying, Daryl. And I know you guys have sat and looked at everything. And I trust completely everything that you're doing. Typically, what makes me more comfortable is just having, him present to ask questions. But now I know that if that wasn't conveyed to him, then that's just not why he's here. But you're saying that then if the alternative here would be to deny, but there's no way to the table.
No, you can table. You absolutely can.
Okay.
I just don't know what will change.
Yeah, true. True.
If he shows up, I'm not sure what changes.
All right. I'm good.
I'm willing to accept that his interaction with Mr. Bridges was acceptable. That's enough for me.
Chair Hallbauer, can you call for the vote again?
Yes, we're going to need a motion to accept this agreed order.
So moved.
Second.
And Pastor Roy, thank you, Dr. Taylor, for the second. There is a motion. Is there any further discussion? Okay. All in favor of the acceptance of the agreed order for eligibility in the matter of Eric Escamilla, please raise your hand and state aye.
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 Okay. Any nay votes? Okay, thank you. Moving on, number 7, Christina, second quarter orders, please.
Yes, so we did have one that was in your board packet that was complaint number 1061-19-0229 for Cynthia K. This has been executed by the executive director. So this is already, executed. It's just for your reference.
Board, any questions regarding that? Hearing none, we'll move on. Number 8, reports review. Christina.
So I did email you all here shortly, or just a little bit ago, for the Q2 reports. The ones that was in your packet was actually from 2021. So I have sent you guys the 2022 performance measure reports. Also in your board packet is the enforcement status report and the complaint dismissal report. Also, just for reference, I did provide you guys with the total number of licensees that we do have currently. I provided you, March and April, just for your reference. Did anybody have any questions on the reports? We do have a new attorney now, so he's getting, his feet wet and whatnot. So I do expect the numbers to continue to increase going forward. And we'll see where we go from there.
Christina, we had 27% increase in being resolved within 6 months.
Let me pull that up.
Or is that just saying 27% of complaints are resolved within 6 months?
Are you on the enforcement status or which one? Yeah.
Performance measures calculations fiscal year 2022, page 3 or 2, I guess.
Let me look at that one.
You say page 2, Dr. Taylor?
Yeah, I'm just curious, is that just saying total or is that increase? You're saying that's the amount of,
On the performance measure, right?
yep, percent of complaints resolved within 6 months, first quarter, second quarter. You're just saying 27% of them are resolved within 6 months? Is that what you're saying?
Daryl, I'm gonna throw that one at you.
No, I'm not seeing the 27. Overall, we're resolving 7% of complaints within 6 months. Now that factors in a lot of the complaints that were in the backlog, so that's skewing that number some. 5% the first quarter, 8% the second quarter, and then overall 7%.
I mean, I'm seeing what Dr. Taylor's seeing, and so.
Daryl, I sent an email of I had in the packet is the incorrect report.
Okay. All
So
right.
I just sent an email with the newest one.
Okay.
And I think page
2. Page 2. It is page 2 of the performance document.
You see it?
Are you looking at the one from April 22nd? Do I have the wrong one pulled up?
Do you have your emails?
Yeah.
You're correct, Dr. Taylor. 27% of the complaints are being resolved within 6 months.
Thank you.
Did that answer your question then, Dr. Taylor?
I did.
Awesome.
John,
Thank you, Daryl.
let's get to work getting these resolved faster. Let me know what you need.
And John's helping us out, but we do have the 2 new attorneys, which is Ms. Benitez and Attorney Long, who just started also. So they're going to continue working as quickly as possible.
Let's get rocking and rolling.
I will tell you all as an anecdotal observation, I seem to be signing more orders on social workers than LPCs. So the heat has shifted from counseling to social work now, if that makes y'all feel any better, the public.
And that's all I have for the reports.
Are there any further questions? Moving on, number 9 is SOA matters. It's my understanding that we don't have any cases for today, but that we just have one close. We do not have the record yet from SOA. Patrick, is that correct? And is there anything to add?
No, we'll have something in the next board meeting for it, I think.
Okay. Number 10 is rulemaking. We had a bit of a scheduling quirk here. Generally, we meet after the VHEC meeting, but that's not the case this time. VHEC is coming up in a little over a week and a half. So these matters that are pending with VHEC are still pending. Not expected to have any issue with them. But generally there's nothing to do here because we jumped ahead of them in line, and usually we follow them. So there would have been more to do here, but just based on the scheduling, these are gonna, everything under 10A and B is gonna sit for now. Daryl, is that correct?
Yes, sir. It'll be on the agenda for BX May 18th meeting.
Okay. Any questions on that? Item 11A, Rules Committee. A lot of this has already been addressed back in number 4 in our discussion on 681. I would like Mr. Line, if he is here, part of our Zoom, I would like him to know that we did receive his letter regarding supervisor requirements. We did not add the request to today's agenda as a petition, but the committee did want you to know that his proposal is going to be sent to the BHEC Standardization Committee. And that if you would like to do so, you will be welcome to speak at public comment. Dr. Taylor, anything to add to that?
Well, just that committee doesn't have a public comment section. So, but Daryl, we could probably invite him, I guess, I suppose, to come speak at that committee at some point if we'd like.
You could. I thought Chair Hallbauer was referring to this public
Yeah,
comment
today.
in this meeting.
I see. Yes, then yes, he would have that opportunity.
He's welcome to,
Yeah.
he'll have 3 minutes to advocate for that petition in public comment today.
Yes, which we did read and gave a lot of consideration to. You can also have the opportunity, if he wants to speak directly to the Behavioral Health Executive Council Standardization Committee, to speak at the public comment on May 18th. I believe that's our next meeting. Is that correct, Darryl?
Yes, sir.
So he can speak there as well. And then I don't know when the Standardization Committee is meeting again, but I'm sure it's after that. And yeah.
Yeah, it'll be after I get the strat plan and get started on the LAR.
Yeah, Mr. Line would want you to know that this is not an attempt to just kind of procedurally dismiss your petition. The BHEC Standardization Committee is where a lot of our current change and action is right now. It's a good place for this to be considered because there's a lot of good ideas and a lot of changes that are coming out of that committee. We'll talk a little bit more about it here in a little bit, but if you are still around for public comment, please weigh in for us. Okay. Rules Committee, anything else to add to that? Okay. Item B, applications. Dr. Bradley, will you give us the update from your committee, please?
Okay, here's the update from the Applications Committee. We met on April the 4th by Zoom and discussed information that we received from NBCC. Basically, NBC is offering and administering the NCE by internet-based online proctored testing at an appropriate location, and that location would be selected by the candidate. Our application committee discussed this charge, and we support the discuss this change, and we support the change. So we were in favor of allowing applicants to participate in the internet-based testing. I don't think there's any action needed by the board, but I'll defer back to you, Chair Hallbauer.
I like that decision. Is there any change that we have to make in order to give it our thumbs up?
No, sir. I've actually already, after my discussions with the applications committee, I wanted to float it by them before I did anything on behalf of the council. Floated it by them. We all thought it was a good way to go, or an acceptable way to go. So I've signed the agreement with, who is it, NBC?
NBCC.
NBCC.
Yeah, there's so many acronyms.
Yeah.
I've signed the agreement with them, so we're good to go. No action necessary.
Well, since you signed the agreement, I guess I'm okay with this. All right, thanks, Daryl. I appreciate it.
Well,
Bradley.
our university has participated in this for not a long while, but we haven't had any major problems as long as they have access to the internet. I mean, it's very well done. They have to, for example, have a smartphone, a computer. They observe not only as you're observing me now, but they can see behind. They can see if they leave the site. So based on that experience, I I think it's a good plan.
Great. Dr. Bradley, anything else?
No, sir, I think that completes it unless the committee members have something to add.
Any questions for applications? All right, thank you very much. Counseling Compact, our first Counseling Compact Committee report, and we have met, and I will hand that to Dr. Amuna for an update.
Awesome, awesome. So we did meet on April the 12th, and we've decided that we are in support of the Interstate Compact. Some great news that's happened since our April 12th meeting. On April 21st, the 10 states required to form the Interstate Compact, thank you, Christina, has been put in, legislature has put in for that 10 states needed to form the National Commission. And so now there will be a national body, a national commission to work on getting other states into the Interstate Compact. During our meeting, again, we agreed that we are in support and have been given deliverables to work on in assisting Texas in becoming one of the states that's a part of that compact.
That's fantastic news. For a long time, the compact was just kind of existing in theory, but now it has been realized, reached those 10 states. It does change the dynamic of the discussion that we have. It's no longer Texas should join this thing, which may come into play in the future. It's now Texas should join this thing that is already up and running. And I think there's some advantages to it because any sort of problems with the implementation, we will be able to kind of observe from a distance and identify any issues that came up for the states that joined and just be able to anticipate them. So thank you, Dr. Amuna. Any questions for the Counseling Compact Committee?
Daryl, I have a question for you. I don't know if it's for you. I sort of talked to our chair about it, but in terms of our position as a board, I mean, I know it's going to have to go before legislation to be adopted, but do we plan as a board, or can we adopt a resolution, or is that not possible, or can you? I just want the board, I mean, I know we are already in support of it, but that would be my question. Can we as a board adopt a resolution?
Yeah, I think you could adopt a resolution. Now, it's my understanding that y'all have already indicated. I walked away a long time ago with the impression that y'all were supportive of it. So I certainly don't need that to know where you stand on it. But if you wanted to make it make a public statement now, yeah, you could adopt a resolution.
I myself would like that.
Yeah, what we can't do is actually go over to the legislature and say, you can't send me over there and say, go lobby for that.
Right.
I can't do that.
Understood. So, I mean, I'd like to see some resolution or something. So is that just something that I could maybe request at the end of this meeting, is request an item for that, or?
I'm trying to think if that's going to need to be, Patrick, we need to put that as a specific agenda topic.
Yeah, this is just a committee report. I don't think this is really an agenda item that's on this to vote on for this agenda. So if it's something for the next one, but I do feel like that there was a previous agenda item on a past board where everyone voted and they basically said they're in favor of it. So I feel like that sort of already was done, I think, at a previous meeting. If I remember correctly, that I think that was done at a past LPC board meeting.
Would you look, Patrick? I just want to make sure that the language is there. I'm sorry, I'm going to be a stickler about it. I really am going to advocate for this. So I just want to know that the words are there, the language, adopt a resolution.
What I think what happened at the previous meeting is I had come to y'all wanting to know, if I'm asked about this by a legislator, what do I tell them with regard to whether we think it's a good idea? And y'all gave me permission to say, we're supporting it. We're behind it. Yes. So it's a little different than what you're saying. Ms. Compagnoni. So what I would recommend is, let's go ahead and put it on the agenda for the next meeting. And then y'all can make a clear, unequivocal statement that you support it. And of course, I've still got my marching orders that if anybody asks me, I'm going to tell them, yes, we're supportive of it.
So we need to come back to the Counseling Compact Committee to draft that resolution to bring to the board. Is that?
That would be a good spot for it.
And I'm okay with that. I'm okay with that legwork. I agree with Brenda that I like to have something formally saying that we do support it. And now we have language, Daryl, I'll need your expertise, but we can have language saying that it's not just something we're supporting in theory, but it's something that's already been implemented by other states in our resolution.
Yeah, Dr. Mehta makes a good point. The language on the resolution is a little different now that the compact's in place. I think this is great news. I was concerned that, you know, how close we get to the line of exceeding the possibilities that we can do as a board. While we're all individually for it, we can't advocate on behalf as a board. But if a resolution is perfectly acceptable, yeah, let's do it.
And Daryl, you might be the best person to add some clarification to the public at large, but just because the board supports this does not mean that the board's able to drive this across the line, that the individual members of our state have work that needs to be done.
Correct. The board can't carry this water. It's going to be either a state association or an involved stakeholder, which that could be an individual licensee that grabs the ear of his or her state rep or state senator and convinces them to carry the bill. What I don't want is people to think that only the state associations can do this. Now, that's the most likely and probably the best suited bucket to carry the water, if you will. But individuals can contact their own their own senators and state reps and say, hey, this thing's in existence. I support it. I'd like you to take a look at it. We can't do that as a board. We cannot do that. Now, what we can do is if a stakeholder reaches out to his or her elected official and says, look, contact the board. They're supportive of this and they can give you all the data and information that they have. We can do that. We are absolutely a resource for any legislator that wants to, carry this bill. So don't hesitate to mention us in that way. We're not going to get in trouble because you say, talk to the board. They can give you the data or the stats that you need. We can certainly do that and will.
Go ahead, Dr. Bradley.
I think this is wonderful news. As you all know, Nebraska became the 10th state, but I know of 8 other states that are getting close. Now, you know as well as I do that it's not a reality until it passes. So I know, and there are 3 states that aren't as close as the 8, but they're also pretty close. But at any rate, I think it's great news. I think Brenda has a good idea about a resolution. And I think that we can pursue that because I do think it's important that the public know or individuals know that we do support and endorse it. Seems to me like TCA and their divisions might be a good starting place. But I agree that individuals can make a big difference too. So that's what I was thinking, but I think it's wonderful news.
Dr. Bradley, I know that TCA is on top of this. They are monitoring a couple of these runoff races that still have to occur, but they understand that the board considers it our top priority for the upcoming session. We've been very clear on that. We have good communication and good relationship with TCA, and we know that they will do a lot of the heavy lifting on this. And so we just need to let them know that, yeah, you have to do the heavy lifting, but we'll kind of we'll push a little as much as we can. Okay. All right. Anything else?
That's all we had, sir.
All right. Thank you, Dr. Amuna. Number 12 is our board chair report. I'm going to start off with reminding everybody that our first LPC-based Insights Over the Lunch Hour presentation is next Thursday. Vanessa has done the lion's share of the work on this. She has put together the PowerPoint presentation. Dr. Taylor has been an excellent Robin to her Batman. I'm going to let both of them speak just to kind of maybe give a little bit of insight on what the planning session has been like, and just give them a chance to promote the event and let anybody watching this, let them know the value they've received by joining us on Thursday. So Vanessa, if you want to go ahead and start it, go ahead.
Sure, thank you. We are gearing up for next week, and I'm very excited. It's been just a really honor to work with Dr. Taylor and learn about some various scams that LPCs are vulnerable to. And so he has helped to identify those, and we've created kind of the background presentation that will kind of supplement the content and the presentation. And I think it'll be a great complementary blend of all three. So I'm looking forward to it. It'll be my first one, so I'll just be there really to, did the legwork and just gleaning from Dr. Taylor. And I think there's one section that I feel adequate to speak on, and it's outside of, just scamming in terms of the licensees, but just general scams that people are vulnerable to. And I think it's applicable to everyone. So I'm looking forward to it. And yeah, that's what I have.
Thank you. Dr. Taylor, anything to kind of add to that?
No, I think Ms. Hall pretty much covered it. I'm excited. It's going to be fun. Lots to talk about internet scams and trolls and phishing and all kinds of stuff. It's going to be great.
I would just add that I want the board to know, I want anybody watching this to know, obviously a scam it's all targeting the same thing. It's an effort to get your money. And Christina over here has agreed to handle the part where she explains the only circumstances that the board would ask, or staff, I apologize, the only circumstances where staff would ask for money. And that is valuable information. So people are absolutely clear on when they're being asked to make a payment, or else your license will remain in suspension. That is not what staff does. These are the circumstances where they will contact you and it's a financial issue. And I don't know if they specifically want to talk about it, but I know there's a board member here who was targeted. Jane, do you want to?
I will.
This was amazing to me. They targeted a board member on this scam, and Janie can vouch for the fact it was pretty persuasive.
And I would just endorse, for everybody to go and to educate yourself. I received one of those scam calls, and I think it's because we've been having discussion about, hey, beware of scam calls. But initially, I was very concerned with the information that the person was sharing with me, and it wasn't from the board. It was in regards to a court order from a judge and failure to appear and things like that. And I had shared with Dr. Taylor and Chair Halbauer that really and truly, I was taking notes and writing down citation numbers and concerned about what was happening right up until the person asked me to Zelle them cash. And so this is real. None of us are immune. So much of our license information is public knowledge, and these scammers have access to all of it. So they can get information about us being licensed professionals, and then, all they got to do is Google us and take a couple of minutes on my website to see what my specialty is or whatever. And then they, pick whatever their script is. It's real. Being in any role as a professional makes us vulnerable. And so I think it behooves us to educate ourselves. So thank you, Dr. Taylor. Thank you, Ms. Hall, for the work that you're doing to educate those of us as professionals. And from what I mean, this isn't going to cost anybody to go get this education. So really, let's both protect ourselves, our practices, but also the public. Because if we're wound up in stuff from a scammer, then that makes us less available to the public. And so anyway, yeah, it's real.
Thank you, Janie. So thank you, Dr. Taylor. Thank you, Vanessa. I'm looking forward to it. You guys have done a lot of work on it. I think it's gonna be fantastic.
Harold, did we sort out the CE for it?
Yes.
Good.
Yep. People are going to get an hour.
Good.
Good.
So y'all got to stretch it out for an hour now.
Oh, that'll be difficult for Dr. Taylor. Love you, Dr. Taylor.
All right, moving on. If you next, if you haven't done it yet, your personal financial statements were due a week ago on April 30th. So if you haven't done it, get those finished up. Daryl, any idea if we are all compliant or anything you've heard?
I don't know. They won't contact me if you're not in compliance.
Okay. So if
They will reach out to you directly.
If you haven't done it, get it done. BHEC issues. Obviously, I don't have as much to update on BHEC because our meeting is happening before the quarterly BHEC meeting. That's coming up on the 18th. As far as I know, BHEC is still on track to move to their new offices in June. But at this point, we can't give any sort of commitment or specifics on whether our next meeting will be in person. So just kind of watch for updates on that. But as it stands right now, they are going to their new offices in June as scheduled. Okay, and along BHEC's lines, like I was saying, there is the BHEC Standardization Committee, which is where a lot of the action is right now, and Dr. Taylor is our representative on that. So anything to add on standardization?
Well, just real quick for clarification, Daryl, are we just waiting for the move and then it is our intention to go back into the office for all future meetings? Is that what we're waiting on?
It'll be up to y'all what you want to do. If you want to come back in person, go hybrid, or stay like you are.
Well, I'm in favor of anything that is not a hybrid. So specifically cars, but also Zoom meetings as well. But anything that's not a hybrid, I'm in favor of. So, and then Steve, you wanted me to speak on behavioral health
standardization committee. Because y'all do interesting stuff over there. Is there anything that you want to add on that?
We're in a very spirited debate right now over CEs. It is still blows me away how passionate we are all about CEs. They're like, wow, man, I made this joke at TCA 2 years ago when we changed the complaints process. Nobody cared. We went to the ISC's process, no questions, nobody cared. Talked about not issuing CE providers anymore. It was madness. It like there was a revolt you were there, Christina, you remember. Like I thought they were going to start throwing tomatoes at me. Like it was like the worst. You change one CE and everybody gets upset. But so we're in a very interesting and spirited debate right now. I was unaware, I've been educated a lot. I was unaware how differently each board approached CEs in the past and what each board found to be very important and valuable for that particular body. So combining this has been really interesting as far as trying to get on the same page with each other. I'm still very hopeful that it will occur. I think it's probably going to go through another iteration, maybe 2, maybe even 3, before we actually get to a finished product. But that's been our main topic right now that we're very excited about and working pretty hard on. That's what we got right now.
Good. And Daryl, is there any update regarding the proposed fee structure reductions that came out of BHEC? Is there any update on it? Or
Yeah, we're actually bringing that proposed rule change to BHEC on May 18th. It'll be proposed at the BHEC meet. Well, it'll be brought before y'all for proposal, and then the council will decide. Now, keep in mind, it's a proposed rule whose effective date, if adopted, wouldn't be till September 1st, 2023. The reason being is we want to make sure we give the LBB and the legislature ample opportunity to understand the effect of that significant of a drop in fees and what it'll do to revenue for the state. With the mindset of, if it's going to cause a problem, we have plenty of time to correct it without jerking the rug out from, underneath people. So yeah, that's going to come before the council on May 18th.
All right. That's all I have for the board chair report. I'm going to hand it to Christina for item 13, board administrator report.
All right, so we currently have 4 staff members for LPC. From what I understand, we are hoping to get a 5th member in the near future. Staff are continuing to rotate days, answering calls, and processing the applications the other days. A big thing that the licensing manager wanted me to pass on to everyone. So those applicants, the initial application process, please allow at least 6 weeks from the application payment. So we don't see anything unless a payment's on there. So sometimes people apply, they've submitted a couple things, attached a couple things on their application, but they assume that we've already seen everything. We don't get anything until that payment process is done. So double check your junk email also, because emails are being sent out. That has a lot to do also with the fingerprint process. In the body of the email, it says exactly what you need to do. And I don't know if it's going just to junk mail, or it's something that people don't think about going back to check their email. It will also come from a do not reply email from BHEC. So it's not something that's you would, I guess, think of right off the back, but it does say do not reply, but it has all the information in there that we need to do, and that's for the initial applicants. Deficiencies are still being sent by email. It has been working very well. If there is no email on file, we do have to mail it, which does slow the process down a little bit. So for anyone, if you can double check and make updates on your account, your renewal online account, you can add the email in there. So just make sure you have good information for us to contact you at. Phone calls and emails, they continue to be very, very high volume. So staff are going as quickly as possible, but again, having to review everything to board rule, which hopefully today's change will help that processing time a little bit more. But just bear with them, we're doing the best we can. And using that contact us form has been really helpful as well. It does connect that response directly to the person that it needs to go to in order to resolve the deficiency. Let's see. Upgrades, they do need to be completed online. So the supervisor will log into their online portal. You will complete the upgrade application for the LPC associate that you have. There's no fee, but you will go ahead and go on there. You'll plug in the hours, but that generates that upgrade application for staff to know to process the upgrade. So just keep that in mind. There is how-tos on our website in order to do that. So check those out if you have any questions or concerns on it.
And you access those from the homepage, everyone. So when you get on the landing page for BHEC, look in that main menu on the right-hand side, and it says how-to guides. Look in there before you email or call staff. If you're wondering how to do something, check that how-to guide first, because Tim Spear, our Director of Operations, has done a pretty good job of creating comprehensive sets of instructions for the various tasks that you can accomplish online. We are trying to expand our online self-service functions so that we don't have to have people emailing and calling us. That's part of the thing we're trying to do is in our strategic planning is enhance our digital footprint.
And on that note, the staff are working from home more now. And so the best way to communicate with staff is going to be through email. So make sure those email addresses are on file. The communication is just easier that way. And you have something in writing on your end to say, well, the staff said this or whatnot. So it's kind of a footprint of the process, that you're going through. So again, staff are doing the best they can. If you look at the processing times, if you go on the website, it shows you what processing times we're at right now for new applications and out-of-state applications. LPC staff are working on April 16th right now, which is very, very good. And then for upgrades and the supervisor applications, they're working on April 27th. So if you applied for something before these dates, you need to go back, double check your junk email, go double check your email, because there may be something holding you up, and staff have sent you an email saying what you need to do in order to complete your application that you submitted.
And I typically update those dates on Friday afternoons, just before 5 o'clock is usually when that chart is updated that Christina is talking about.
Yes. And let's see, for renewals, they're processing in April. Continue to upload your CEs if you are selected. We only need the CEs attached if you are selected for audit. And just a reminder, you do need to do the 1 hour of human trafficking, which on our website, we have all the information on there. Like Daryl said, Tim has put as much information, useful information in there that you guys can access to try and complete all of the requirements. It's there. I just have to try and, look for it and find it. Again, the fingerprints is a big issue.
Real quick,
yes.
if I may, Daryl, I'd like for us to issue some kind of formal complaint to HHSC. I took the human trafficking course, and it was very difficult to navigate when I just did my renewal. I mean, very, very difficult. And part of the problem was they don't have any recommended browsers or platform to use. I know it's a free course, and that's great, but it was so difficult for me to use. It kept timing out. I mean, it was a 1 hour course. It took me 2 days to get through it, because it literally, like, I would schedule an hour to go do it, and then it would just go into a little spin of death for like 30 minutes, and I had to go do my other thing, and I'd have to come back to it. So it was really, really frustrating for me. And I mean, I feel like I'm pretty tech savvy. So, I've heard complaints from other people as well. I recognize that it's a free course. And so beggars can't be choosers. Like, I appreciate that, but they need to at least have some disclaimers on there about use Firefox or Chrome, or this is the best browser, or this is the best. We got to do something though.
I have talked to them in the past about, because I agree, it was especially when it first launched, it was incredibly difficult to get registered for that course and complicated to understand it. And so I called them personally and said, what's the issue here? Why is this so difficult to do? And candidly, what happened was, when that got imposed upon them, the legislature passed that, they had to retrofit an internal system to where it was then publicly facing, so that licensees from the various professions could access it. That's a big part of the problem right there. They have retrofitted what is supposed to be an internal registration system for the public, as a public facing portal. So that's a significant part of the problem. But I'll visit with them again and see what we can do about, like, listing browsers and that kind of thing.
Whatever we can do, just because, or even just on our own website, where it has the list to say, if you're using the free one, we recommend that you use Chrome, or you use, don't use Apple products or whatever. That way it makes it a little bit easier for people to, because we're telling them it's required. We're telling them they can't, get a renewal without it. It just seems very unfair to have something that's so important, just have such difficulty accessing.
Understood.
Yeah, and to feed off Dr. Taylor, I'm sorry, go ahead, Dr. Bradley.
I was going to say, I also had trouble, but The trouble that I had was when I'd finished it, I thought I was going to lose all the credit. Printing out the verification, that took more time and was more troublesome than taking the training. And it took hours. Now I did finally get it to make it work, but I sat there kind of panicked. My goodness, I've spent all this time and I can't get the verification. So there's that issue too. That part's not user friendly.
Thank you. And this kind of feeds into my next mention here is that don't wait till the last minute to renew your license, because you never know what is going to be going on during that time or what issues you may run into. And if your license expires, you will have to reapply or go through reinstatement depending on what type of license you hold. So just make sure that you don't wait till the last minute, get everything done. I think we're 60 days, right? We open the applications up 60 days prior to expiration.
It's actually a little more than that.
Okay. Okay.
I think we tell people 60 days.
Okay. So that's a good starting point. Put it on your calendars, when your license expires, and do it at least 60 days before, and just make sure you have all your boxes checked at that point.
And please, 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 everyone, make sure your address is current in the system, your address of record. I cannot tell you how many times I get angry phone calls and people upset. I didn't get notice that, I didn't get my renewal reminder. And my response is typically, well, it's your license. So you're charged with responsibility of knowing when the renewal date is. But 2, you didn't update your address in the system. So it's not our fault that you didn't get the notice. So I don't mean that to sound harsh, but that's just the practical reality of it. You've got to tell us where you are if you want us to send you notice. So please check that in the system. You can check and change that at any time. There's a how-to guide on how to do it. So go check it out.
Yep. And other than that, related to the enforcement compliance report, we currently have 22 cases that are agreed orders that are being monitored right now. But that is all I have, unless anyone has any questions for me.
No, great work as always, though, Christina. You are very much appreciated. Thank you for all you do.
Okay. Thank you, Christina. Moving on.
Absolutely echo Dr. Taylor's comment. Christina, we appreciate you.
Thank you.
Moving on, agenda item 14 is public comment. I would remind you that we did receive 3 written comments. Hopefully everyone has had the chance to review those. Yes, chris.
Mr. Chair, before we move into that, Darryl, was 13 where I was supposed to bring up the
yes, sir.
Oh yeah, okay.
Yeah.
Real quick. We had an issue, I guess, recently where a licensee was issued a license and they shouldn't have been, and we requested that they destroy it. I had a big, when I heard that, I had a big problem with that, just because I know that getting that license, is like, you got to have it to get a job. And I mean, we're talking about people's livelihoods, we're talking about their careers. I don't like the idea of people walking around with a license that didn't earn it, but at the same time, if there's an administrative error, I'd like for us to have a discussion on how to handle that moving forward at some point, to where staff isn't left hanging, asking people to destroy licenses. I don't ever want us doing that. So I don't know what legally we need to do. We don't have to have that discussion today. This is, I think, the 2nd or 3rd time as a board member in my career I've heard of that happening. I know it doesn't happen often. I know it's not intentional. But once that person has that license in their hand, I mean, we've changed their life now. They're now a licensed professional counselor that can go out and, they're taking on clients. They're working with people. They're taking jobs that require those licenses. And we say, hey, never mind, April Fools, please destroy that. I mean, that has a real impact on not just a person, but many people. So I'd like for us to have a protocol in place for what constitutes that. Are we even legally allowed to do that? Because once it's issued, right? So, are there legal repercussions for that? How should we handle those cases if we find that a license was issued erroneously? And how do we resolve that? So if we can add that to the next meeting, or if we need to have a committee discussion or what.
That's probably actually needs to be handled at the council level, because that's going to be a council issue rather than a board issue. So that's something we'll have to talk about at the council level.
Let's put that wherever that goes, because I mean that's that I find that to be a very important topic.
Will do.
Thank you. And again, nothing against staff. I know how overburdened we get, and I know everybody makes mistakes, so I don't blame staff for it at all. I just want to make sure it gets the attention it deserves, and that staff is not put out, so they have a directive of, if this happens, what do we do?
Thank you, Dr. Taylor. We'll go back to item 14. I did want to bring to your attention to make sure that you review the written comments that we received. We have 3 of them. Please take a look to go through those, make sure that you had a chance to review them, and if you had any questions on them. But at this point, we will move over to public comments. You have 3 minutes for comment. Patrick, please give a 30-second warning for each speaker, and Christina will handle the Zoom on this.
Yes. So I'm gonna start with, let's see, Mr. Line. I know I saw you. There you are. So this is one that we had received a written public comment on. And Mr. Line, you are ready. You are free to speak, and you have 3 minutes.
Thank you. So it's actually Mrs. Line. I don't want to surprise everybody.
Thank you. Sorry.
That's okay. My name is Ahu Vaziri Line. I'm a licensed professional counselor, and I'm speaking individually in regard to the LPCS requirement and the letter that I sent you all. I appreciate your time today in discussing my letter, and I really do thank you for your service on the board. I'd like to take a few minutes to share additional support for my advocacy efforts. I know the letter itself was very long, but there is more. I have created and circulated a petition among doctoral students, graduates, and faculty in Texas. And in less than a week, we already have 61 signatures to support these advocacy efforts. I'm happy to send along both the petition and the additional comments to the board for additional consideration in your May 18th meeting and in your strategy meeting. Among these 61 signatures, there are current doctoral students, graduates of doctoral programs across the state, faculty members of both KCREP and non-KCREP programs in Texas, private practitioners, and many LPC supervisors that are in support of this change. Among the individuals who shared this concern and signed the petition, there were many issues that were actually brought to my attention that I didn't share in the letter, and I'd love to share them with you to give voice to their concerns as well. First, many shared that my suggestion of 3 years post-licensure was still too long, as it did not provide equity for the individuals who choose to pursue a doctorate. Many shared that they hope that the board considers even less time for post-licensure requirement for doctoral graduates. Second, many stated that they have additional training and assets to add to the field of counseling, so this rule change would benefit the field in many ways. For example, many shared that they're bilingual counselors, have additional training in areas such as trauma, play therapy, and multiculturalism, which they hope to use to support LPC associates in their skill development. Third, many individuals shared that the doctoral supervisors that they are trained across the developmental continuum, which allows a strong basis for which to supervise new associates with differing skill levels. Additionally, individuals that signed the petition shared that because we are waiting the 5 years post-licensure, many of us are deterred from further training and practice and supervision and are not regularly using our skills. Most impactful from the voices in the petition was the statement that many individuals who signed the petition were given the choice to move out of state after graduation to pursue a faculty position, and the 5-year wait time for supervision heavily influenced their decision. That being said, I do believe this rule change will greatly benefit the field as we can retain incredible counselors and supervisors in the state that can bolster the field of counseling. With so many new associates, this influx of supervisors will benefit the field and support the associates who are seeking supervision. Again, Thank you. I appreciate your time and consideration that you gave to my letter, and I appreciate further discussion on the May 18th meeting and your future strategy meeting. And I do appreciate your service to our profession. Thank you.
Thank you, Ms. Meyer.
The next person I have is Catherine Bacon.
Good morning, board. I am Dr. Catherine Bacon, Texas Counseling Association outgoing volunteer liaison to the board. We appreciate the opportunity to provide public comment today. TCA does not have a formal position at this time on the petitioned rule changes to section 681.2 and 681.83. However, we do believe with time to convene a task force, develop a position, and the opportunity to engage earlier in the rulemaking process by having the Rules Committee and the Application Supervisions Issue Committee meetings open to the public, as a stakeholder group, we can be a helpful resource for the board. For example, as liaison, I was in the room that Dr. Taylor referenced 4 years ago when 681.83A was wordsmithed, and I remember the discussion surrounding the rule, the rationale for creating it, the meaning behind the words, and the spirit of the regulation. I was not the only stakeholder in the room. It was 12 hours, by the way. Whew. And believe that by having the Rules Committee meeting open to the public, it helped create an intentional, thoughtful, shared governance process. Although this will be my last meeting as liaison, it will not be the last meeting I attend. Before I was liaison, my appointment, I attended the committee and board meetings as a member of the profession and the public. I recall how meaningful it was to my professional development to hear the deliberations. It helped me become a stronger counselor and citizen. As a doctoral student, the board once held their meetings at the university where I was enrolled. This was impactful as a student and newly credentialed supervisor. I look forward to continuing to engage the board as a professional and the leadership of our incoming liaison, Angela Bowles. I appreciate the service of the board, as I know how much of an honor it has been to me to serve as your liaison. Thank you.
Thank you, Dr. Bacon. We'll miss you, but I'm sure we'll see a lot of you still.
Next person is Rhonda Kimball.
Hi, everyone. I just wanted to give a great report on, I just upgraded to LPC and it took 24 hours. Hello, that's some good news, okay?
That's a record.
Right? 24 hours, my supervisor and I were just floored. I just have to, props to all of you. It's working, Christina. Everything's going well, right? Thank you, thank you, thank you for that. So appreciate it. I have another, I'm starting a doctoral program and I heard CEs come up, but I had a client. So here I am. So my program is going to be 2 years, which is going to be my renewal period, 57 credit hours. But if I read the paperwork correctly, I only get to count 9 as CEUs. Can we count the whole thing? Like 20, can a whole doctoral program, 57 credit hours, count as 24 CEUs? Would that be something you all consider?
Can you email your inquiry into us? I don't want to just without seeing anything or having a better understanding. I don't want to just throw something out there. So I feel it'd be best if you go ahead and just send us an email and we'll go ahead and look at it and respond to you.
Perfect. Thank you.
Thank you.
Thank you, guys. You did a great job. Thank you.
All right, next person we have is Jason Martin, which I believe was one of the written comments as well.
Hello, can you hear me?
Yes.
Hi, thank you for hearing my comment. My name is Dr. Jason Martin. I am a faculty at the University of Mary Hardin-Baylor, and I'm also an LPC supervisor and actually serve as the current president of the Texas Association for Marriage and Family Therapy. My written comment and as well as my spoken comment today regards the 60-month limit on LPC associate license. While I generally support such a limit in most cases, I believe that there are situations where additional time is merited and necessary and would be in the best interest of both the licensee and the public for the board to have mechanisms and allowances for that to be extended, either on a case-by-case basis or whatever measure in which the board sees fit. I request that the board either take a look at that, or if that is deemed not appropriate, to better equip the information given to licensees and the online licensing system to help facilitate the reapplication process. As it currently stands, I have a supervisee who needed to exceed that 60-month limit for reasons that may be discussed later in a different public comment. And we determined that the process by which to extend her license or even to reapply was far from clear and at times contradictory based on information on the BHEC website. There were various forms that were referred to that were not on the website, and the online licensing system was ill-equipped for situations such as hers. So I hope that you will hear that request, and I appreciate your time. And the individual that I spoke with should be providing additional comment later today. And thank you again for your service and for your commitment to the profession. I yield the rest of my time.
Thank you, Dr. Martin. We appreciate your comment. Daryl, I did review it. I don't know that a rule change is necessary here, but I do agree with him that in transitioning to the online system, this might have been overlooked. And that's probably because it is a rare situation, but it does happen. We can either put this on the agenda for the next rules committee or something, but we definitely need to get something more clear on the online database for if your 5 years are coming up and you need more time, how to reapply, and how do the hours carry over? Because in some situations they can carry those hours over, but not in every situation. So we do need to clean that up.
That may be something we can do in a checklist.
Yeah.
That way, maybe the simplest way.
The next person we have is Angela Bowles.
Good morning, board. My name is Angela Bowles, and I am a licensed professional counselor supervisor and the incoming TCA liaison. TCA does have a good relationship with the board and are committed to being a partner in the advocacy work for the compact. At this time, TCA does not have a formal position on agenda item number 4 regarding 681.2 and 681.3. However, as a stakeholder organization, we look forward to the opportunity to provide feedback and participate in any discussions moving forward. We appreciate and respect the hard work of our volunteer boards. Thank you.
Thank
you. So, Angela, Catherine, I think y'all are cheating. You can't both go if you're here, but we'll allow it this time.
All right. Next person we have is Jody Jarrett.
Yes, hello, can you hear me?
Yes.
Yes.
Hello, my name is Jody Jarrett. I'm an LPC Associate and National Certified Counselor and current doctoral student at the University of North Texas. Thank you for your time and ongoing service to the board. I'm here to speak individually regarding the LPC supervisory requirements. I'm a Marine Corps veteran who served during the Iraq and Afghanistan wars. When my friends were posting graduation pictures and preparing to enter their careers, I was preparing for deployment. When I transitioned out of the military, a significant contributor to my success was Texas's extraordinary support for the veterans and family members. When I exited the military, I was old. In fact, all the old people in my first semester of classes at college were 3 other Marines and the man who is now my husband. When I started school, I felt behind as if my choice to serve was a penalty that placed me at a career disadvantage, although it remains the most important choice I've ever made beyond mothering my child. In recognition of the fact that many service members and spouses are quote unquote behind and disadvantaged in the workforce, many states and industries have implemented programs that award credit for time served. For example, Texas Commission on Law Enforcement awards hours that count towards proficiency certifications, and Texas Health and Human Services recognizes that some service members and spouses may have the training, knowledge, and experience to meet the licensure requirements for the LCDC and licensed sex offender treatment providers. Although I am in no way equating my military sacrifices to my experiences as a counselor, there are some overlaps as I again find myself behind, this time due to the choice of pursuing a doctorate. While most of my graduating class are fully licensed counselors, the demands of the program have placed me and others who chose this path on the scenic route to licensure. I have come to peace with this decrease in my earning potential because it is worthy sacrifice to achieve my goal of training culturally competent counselors who are equipped to meet the therapeutic needs of diverse communities and military affiliated persons. I am permitted to counsel under supervision, so my therapeutic work is not hindered. This is not the case with the supervisory designation. I am currently empowered to serve in each of the KCREP doctoral training areas except supervision in Texas. And with the current rules, once I am fully licensed, I will still not be eligible to mobilize my training until my currently 8-month-old daughter is in 1st or 2nd grade, which by then my training would be outdated and would be immensely out of practice. Upon graduating next year, I will have 4 consecutive years of experience providing clinical supervision to master's counseling students and counseling psychology interns. It is disheartening to know that in Texas, this counts for nothing. I and other qualified individuals are currently being gatekept from filling the gaps in service. Despite having many wonderful supervisors throughout my training, only 1 out of 6 identified as a person of color, and 1 out of 6 provided therapy in languages other than English. To empower greater diversity representation, lessen linguistic barriers, and retain highly trained personnel, we must evaluate how current rules and practices intended to protect clients may further hinder their access to effective care. Again, I thank you for your time and sincere consideration on this matter. Thank you.
Thank you.
Thank you, Ms. Jarrett.
The next person we have is Mario de la Garza.
Good morning, board members and staff. My name is Mario de la Garza, and I serve as the liaison to the LPC board for the Texas Association for Counselor Education and Supervision. TASIS appreciates the discussion about counseling and counseling-related degrees. Several issues are intertwined with this discussion, including protection of public consumers of counseling services. As was brought up earlier, consumers of counseling services really aren't looking at academic requirements when they are needing counseling services. And therefore, it does fall under the gatekeeping responsibilities of the board to make sure that practitioners do have the required knowledge and the skills to practice. And this then speaks to competence and ability to practice. In terms of parity and reciprocity, Texas standards for licensure need to be recognized as being on par with national standards and standards in other jurisdictions. I think we want to attend to and stay ahead of the national trends so that Texas counselors are well received and respected wherever they may go to work. Based on the conversation today, the board may license applicants who do not meet the academic requirements set forth in your rules, as long as they have counseling degrees from an accredited institution and have passed the required examinations. If a program is accredited by a recognized body, their graduates would be licensed, even if the program has not met the academic requirements in your rules. Is that correct? I just want to make sure that I'm understanding that correctly. TASIS does think that all transcripts need to be reviewed in order to confirm that academic requirements are met. Counseling appearing in a degree name does not mean that required coursework, as you have set out, has been completed. Again, thank you for your critical examination of this complex issue. We also appreciate the board's support of Texas's involvement in the Counseling Compact, so I just wanted to thank you for the committee's work on that. TASIS appreciates the work of the board, and we look forward to providing whatever information that you request from us, from counselor educators and supervisors throughout the state. Thank you.
Thank you. Next person we have is Felicia Burden.
Can you all hear me?
Yes.
Okay, so my name is Felicia Burden, and I would like to present my experience as an LPC associate trying to reapply for licensure. I am the individual that Dr. Martin spoke about, and the current process places undue burden on LPC associates to continue their supervised experience. I received my LPC license in April of 2017. In my full-time job, I'm a manager that oversees grants and programs, but this comes with very few direct hours. In September of 2019, I started at a group practice company where I get the bulk of my face-to-face hours. Being part-time, however, I only average about 20 hours a month. I've been making preparations to go full-time at the practice, but my current full-time job provides the income and benefits that my family depends on, and I've been unable to make the move as of yet. I've accumulated hours and been under constant supervision for the past 60 months, minus a brief maternity leave in 2017. I started trying to renew my license in February of 2022. I called the office and explained that my LPC associate license was expiring and I needed more time to finish. I was told it was too early and the option would be available online within the 60 days of expiration. That option never appeared. And over the course of the next 2 months, I called the board office multiple times, but I never did get a call back. I was later told board staff are difficult to reach by phone and preferred method was via the contact us link. I looked through the board website in depth and I couldn't find any information or guidance on my specific situation. April 18th, the day after my license expired, I was able to get someone at the LPC board staff office. They followed up with their supervisor, and I followed up that phone call with an email to board staff. I was told that I had to retest and reapply because my license expired. The response that I got from email quoted Board Rule 22 of the Texas Administrative Code 681.91. With some information about regarding NCE testing and the scores expiring after 5 years. The TAC code does indeed state that an LPC associate who does not complete the required supervised experience during the 60-month time period must reapply for licensure, but there is no information regarding NCE scores, and there's no mechanism to anticipate and proactively address this situation because the online licensing system does not allow a licensee to apply for a license that they already hold. So there's no way to anticipate this date prior to expiration, which inevitably will lead to disruption in practice and client care. Furthermore, when scheduling the NCE exam, I received an error on Pearson View that states that CCE policy does not allow a previously passed exam to be taken again. This candidate has already passed this exam. So I had to call NBCC back. They had to send in another authorization and I had to call and have them schedule my exam by phone. So overall, it could take 4 to 12 weeks to be awarded a new license. Thank you for taking your time to listen, and I appreciate your service to this board and our community.
Thank you. Okay, next person is Sandra Martin.
Okay, can you hear me?
Yes.
Okay. Only have one point to make today. Others have been looking at the trees, courses, regulations, et cetera, et cetera. We have had our eye on the forest, and we just want to express today our appreciation for Dr. Taylor and others who are firmly supporting the authority of all of the accrediting agencies that function in the state of Texas. Earlier, in an earlier meeting, there was expressed the thought that perhaps KCREP could become synonymous with accreditation. We would battle that with every ounce of our strength. We have lots of accrediting agencies. We want them all used because smaller schools can't afford KCREP. Other schools totally disagree with KCREP. So just thank you, Dr. Taylor and others who have supported all of the accrediting agencies that function in the state of Texas. Thank you.
Thank you.
Thank you, Sandra.
Thank you.
Okay, next person is Dr. Kathy Ibanez Llorente.
Thank you, Christina. My name is Dr. Kathy Ibanez Llorente. I'm a licensed professional counselor and council approved supervisor. I'm also an associate professor and program coordinator at Texas State University for our professional counseling program, which happens to be a KCREP accredited program. I'd like to thank the board for their work and the Rule Committee's review of the academic standards for the earlier item that came up for discussion. The responsibility of licensing boards has always been to set minimal standards for academic standards required for LPC associates, namely the coursework, which we see in 681.83B. My understanding of the allowing of non-review of counseling degrees at application was based on the assumption that those counseling programs are in fact already meeting academic requirements or coursework as set forth in 681.83B, and would not mean that those programs would get to change the delivery or offer courses in an alternate format or eliminate the specific coursework as listed. The accreditation of counseling programs by KCREP means that the program meets national counseling standards within the coursework. It does not specifically mean that KCREP has assured that those programs meet the academic standards for licensure within their states. As a KCREP accredited program for more than 20 years, we've accepted the responsibility of keeping up with the discussions and decisions of our state licensing boards regarding any changes in academic requirements, and we then have made changes to our curriculum accordingly. And this is while we've also maintained KCREP accredited standards. So the board's openness to exploring this is welcomed. I will say that we're all averse to having more paperwork, and a lot of these decisions have been made with the express purpose of helping staff to expedite the processing of applications. But if the board were to ask our program to, for example, submit documentation of how our counseling program meets the academic standards that are currently in place, I, as a program coordinator, would welcome that kind of option. And I say that instead of what some states require for licensure, which is having each applicant submit an individual document showing how the program meets requirements. And oftentimes, as a coordinator, I'm asked to sign those documents. So I appreciate the board being willing to explore this, and maybe something that there could be an easy solution to that, again, does not make things more difficult for the board. And certainly that wouldn't make things any more difficult. But there is a responsibility for programs that are not only counseling, but also counseling related to meet the current standards that the licensing boards have put in place that also happen to be based on national standards. Again, thank you to the board for your volunteer work and all that you do for our profession of counseling. Thank you.
Thank you. Okay, and the last public comment we have is Dr. Olivia Weddle.
Hi, everyone. Can you hear me?
Yes.
Yes, I'm Dr. Olivia Waddell, and first I just want to say thank you all for your service and ongoing commitment to the profession of counseling in Texas. I'm the current president of Texas Mental Health Counselors Association, otherwise known as TOMCA, and I just wanted to say that we're happy to hear about the committee designation for the work on the counseling compact, and we also extend our support of the compact as a division of TCA. We'll work to keep our members up to date on any and all legislative progress over the next few months and next year. And then also I just wanted to add that quite a few of our members have expressed appreciation for the insights over the lunch hour. So I'm really excited that we have another one coming up. This is I think it's a great idea and just a good way for professional counselors to stay engaged with you all as well. So we really appreciate that. Thank you.
Thank you.
Any phone calls?
No.
Thanks, everyone. Item 15, items for consideration in the future. My notes have that we intend to kind of do an analysis on 681.83A, make sure that it is doing what we want it to be doing based on the way it's written. And then I have that we are going to be adopting a resolution in support of the counseling compact. Those are both on my list. If anyone has anything else to add, let's hear it. All right. Item 16, announcements and our future schedule. But like we've kind of discussed, we have a little bit of scheduling quirk because BHEC is going to meet twice before we meet again. And that's because this next one got moved behind our meeting. And then we kind of get back on the typical schedule, and that's it. BHEC meets before we do. We'll kind of get back on this regular rotation at the end of the summer. But that is kind of just a scheduling quirk. It does not really affect a whole bunch. It sort of just kind of lengthens out the time frame associated with rulemaking. That's the best way to view it. Our next meeting is at the end of the summer. Our next meeting is September 9th. Anybody want to add anything to this scheduling?
The proposed dates. I don't know if you're getting to that.
Yeah, we'll get to it.
Okay.
When do we decide if we're doing that, and how are we doing the 9th, September 9th? When do we decide if that's in person?
Let's wait till we get in the building and we find out what the conference room situation is like over there. Because I know they've got some problems right now with, we're going to be in there before the conference room will be available. So I can't tell you right now what your meeting facilities are going to look like over there till we get in there.
Yeah, Chris, I think it's while we may be physically able to get in there, there has to be a technology component that has to be ready to go. We're committed to these YouTube recordings of minutes, and that is going to be a requirement either way. So
we can discuss that, and if we want to add Zoom or not, but I'm just worried about your rental car, Steve. Want to make sure you get a reserve that base model. You don't accidentally get upgraded again. I know that was difficult for you.
I was going to point out that September 9th is the day before the University of Texas plays the University of Alabama in football on the following day, and so that will be a wild weekend down here in Austin. So maybe it's not the right time to be getting back in person, but we'll see.
Sounds like the best time.
Hi.
Either way,
the hotel rates will be a little excessive.
Yeah.
By the way, Dr. Taylor, I will make sure he drives a Chevy Spark to the next meeting.
He needs to. I get annoyed when he gets upgraded. It's not cool.
That's it. I'm flying from now on. All right. Any other announcements? Any other comments?
Yes, just wanted to share with the group that I just officially became grandma for the first time.
Yay.
And I am in love. Boy, when they told me that it was different being a Glammy, it's true.
Give us the stats. When were they born? When were?
Baby was born March the 14th. So he'll be 2 months in May. So, I'm back into the diaper change, stay up at night. Boy, whew, but it's been beautiful. It is beautiful. You love your kids, but when you see the byproduct of your child, I cannot explain to you what kind of love that is.
Well, congratulations. I've always heard that grandbabies are the best because you get all the baby benefits, but you get to hand them back to the parents.
Yes.
Congratulations, Brenda.
Thank you.
Okay, anything else? Before we wrap up, thank you, everyone. This was a good meeting. Thank you very much for your service. I know this is a big ask of your time. And all of y'all always put in the effort required for us to be a very effective, functioning board. We do good work, and I'm grateful for all the effort that y'all put in. I need a motion to adjourn.
I'm sorry. I have to.
Oh, Christine.
I need to make sure these dates all work so we
Oh,
can approve these dates for
sorry.
future meetings. I'm sorry, everyone. I know you're ready to go, but I just need this last thing or Brenda will be after me, so.
They work for me.
Okay, getting thumbs up. I don't think I need a motion, or do I?
I have a comment.
Oh, yes.
I think you should go on with the plan in August, but usually that's when we have graduation, and some of the dates in the future in August, I'll tell you now, I won't be able to miss to come to this board meeting.
Dr. Bradley, I think those are BHEC meetings.
No, this one's a tentative one, but
August 11th, I think is the one that she's talking about, of 2023.
Yes.
Okay.
I think you should go on with your plans, but I don't want to be counted absent without reason, because I'm warning you ahead of time that if I have a PhD student who's graduating, I've got to be there to hood that student.
But I think a year and a half is probably adequate notice, so that's good.
You might say it's adequate notice, but you know how students graduate, and I have no idea who is or isn't going to. So I'm just alerting that while I don't typically miss meetings, I will likely miss that meeting.
Dr. Bradley, do you already have that date for that?
It always occurs, like it occurs next Friday, the 13th. So it occurs that Friday, Saturday weekend in summer.
Oh, okay. Can we take a look at that one then?
I will look again, and that's why we were previously doing September month instead of August. But I can look again and see if I can come back with an August date for you guys.
Okay. No, Dr.
Well,
Bradley.
again, I'm saying go with whatever the majority wants. I'm just alerting you that it would be an excused absence and one that
could be other
I can't commit to.
Well, first of all, we want you at the meeting. Second of all, this probably affects other people as well. Third of all, it's a year and a half away. I think that we can take a look at adjusting that date.
I would hope we could go back to September, but I don't know if it's possible. So I'll just throw that out.
I will look into it. But if we can approve January and April, that would be awesome. And then I'll bring back to the table at the next meeting the final one for that fiscal year.
Okay, so the calendar will be the dates through April 28th, and we will remove consideration of August 11th, 2023 at this point.
Okay.
Good?
Yep.
All right. We got to vote?
Do we need a vote, Patrick? Or are we just thumbs up okay?
No, you don't need a vote.
Okay.
Okay.
All right, thank you.
Okay. Anyway, thank you, Dr. Bradley. That was a good point. We'll take a look at that. Now I need a motion to adjourn. Thank you, Dr. Amuna. Do I have a second? Dr. Bradley, thank you for the second. All in favor of adjournment, please raise your hand. Motion passes. We are adjourned. Thank you, everyone, for your service.
Thank
Have
you,
a great
everyone.
summer.
Bye-bye.
Thanks to everyone.